right, today is Tuesday, February 26th. It is 6:01 p.m. I'll quickly run down the agenda for new and ongoing business, just so folks at home and in the audience know what we'll be talking about. New business, we'll be discussing vaping. Ongoing business is Flint Road landfill, followed by H-Foot Road, Berry Corner Road, and Eleanor Lane. Third up on ongoing business, Burlingame Road water testing. Fourth will be Valley Green Grow project proposal for 44 Old Worcester Road. And then finally, for ongoing business, marijuana discussion. We do have several people in the audience, and unless there's any issue with folks are time constrained, we'll go ahead and start with our new business. Vaping. Last week, this board some of us met with the selectmen regarding vaping. I was not able to attend. However, I did see some of the video, and I thank you for attending. And Kathleen, thank you for reading my brief statement. That was appreciated. So what was the gist of the meeting for the audience, and any takeaways as far as what we can do for a board? Yes.
My takeaway from the board was it was an awareness. You know, we got to make it aware that vaping is not a substitute for cigarettes and tobacco. The awareness part of the health risks from vaping, like you said, some are equivalent to a pack of cigarettes or whatnot. So it's not a easy button. Yeah, vaping, you're all set. You know that it is addicting. So my takeaway from the meeting and from the vaping is we need to make some type of awareness. We also spoke, and we got some good info from the superintendent of Baypath and what the schools are doing to detect the actual vaping things. And they have like what do they say? It's like a metal detector, right?
It's like a detector, and it's in all the bathrooms. So if you vape, and this is John LaFlesh, the superintendent, with the business manager, Dean Yakabuchi. Matt and I spoke with him after the meeting, and I asked him what his plan was for vaping. Like Matt said, there are detectors that you can buy in the school. So if that goes off, they immediately have school resources in there. They'll know that they're vaping, so they can be detected. And they have them in the halls, they have them in the bathrooms.
So I thought that was pretty good as far as being able to catch, to catch the kids are doing it. The other thing, Kathleen, sorry, but the other thing was, we were talking about what if the stores in our town, are caught selling to the minors. So we had a discussion about that. And is there fines and what's the process on that? I didn't say it last week, but generally speaking, in this town, we haven't had a problem with underage sales. There have been some, but they've been very limited, and it's been years that I know about. I don't know the last one but it's not a problem.
It's not a problem. We have stings, tobacco stings. Now remember, it's 21, so you have to be 21 years old to buy any of the vaping products. If you violate it, they have stings, and then you'd get a ticket. It's a minimal ticket. That's the problem. It really doesn't fit it. But some of our stores won't even sell vaping products, like Ted's Variety. They have nothing to do with vaping. They're just the small honey farms, the small country farms. I think there's 4 or 5 that determined that are selling those in Charlton. That's it. Now I think we may be down to 4. That's it.
Yes, Kathleen.
So my takeaway was that the select board was very interested and very committed to doing something about this. The discussion that we had with them was a healthy, definitive discussion where there was some serious concern by all the board members, Board of Health and Board of Selectmen. And in the end, I think we all agreed that it's a matter of educating parents and we, as well as grandparents, because they have grandchildren that are vaping, and a lot of parents don't understand how difficult it was. And up until a few months ago, I really didn't get it till I started researching it, and I realized how damaging it is. The thing I wanted to ask was there was, and I think Karen just mentioned this, but there was something in the paper last week about, I think it was Webster, that is banned all vaping materials to be sold in town, only to be sold at designated marijuana spots. And I was wondering if that was something that we could do here, or would it make sense to do it? What are your thoughts?
You could do, the board could eliminate them, but you'd have to hire an attorney to write up the regulations or adopt it, and would have to contact the Department of Public Health to
Could we
write up,
just
because
use
we don't,
Webster's?
we've never, no, we'd have to write up our own and it'd be adopted. You don't have to post it as in a paper or anything, but if you're gonna adopt it, you just, during your regular meeting, we would notify the people that are selling this product, that they would be prohibiting. But remember, if it's 21 and you buy it, it is legal. It's like cigarettes. It's the same, yet it's
Right.
less. So why don't we do away with cigarettes, in my opinion? But we're gonna do away with vaping because it leads to cigarettes. So I'm not that I'm for smoking in any way, shape, or form, but I'm not sure it's worth the effort. I'd rather see someone vape than smoke cigarettes, in my opinion, if you're 21 and you're able to. And I think that's what you're gonna eliminate. They're gonna go right to tobacco. So if you're trying to eliminate them from smoking and you eliminate the vaping, which is make you 4 times more likely to smoke, they said in the infomercials, but it's really not the higher nicotine end that cigarettes are. So some people, in lieu of smoking cigarettes, vape. So we have to look at it that way too. If you eliminate the vaping totally and it's gone, they're just gonna go to another town, they're gonna vape anyway, or they're gonna buy cigarettes,
You know,
which are not illegal and which are way worse than vaping.
I think that taking it out of regular stores that sell tobacco and putting it only where marijuana is sold might be, as much as I'm against.
We don't have anyone right now, and it looks like it's gonna be quite a while before we do have anyone selling
Yeah.
marijuana.
I can just see, you know, I have to drive to another store and wait in line, and people are now thinking that I'm using marijuana.
And there's the
And all
competitive
that going
spirit.
Is going.
You kind of monopolize the marijuana to encourage them to go there to get vaping materials and marijuana rather than go to a regular store. I don't know, there's pros and cons to all of it. I'm not for any kind of smoking, but I think that I'd rather see someone vape legally than smoke cigarettes, which are 10 times worse and more invasive to things that would happen to yourself. Yeah. But that's the board's decision. If the board decides they want to eliminate it, we have to go follow a process. But there's only 4 stores that are selling it, and I say only 4. I don't think they have big sales, because I spoke to the man at Honey Farms. He says we don't sell a lot of it, and there's a lot there. I even took pictures of what they did have. They're anticipating the big rush when the marijuana place opens up, that they would use these devices for not only vaping but using for marijuana.
So basically, nobody can buy these unless they're over 21 anyway.
Got to be 21.
Right.
Yep.
So.
But somehow it's getting into the hands of underage vapers, obviously, because
Mhm.
we're hearing now middle school, high school, certainly not 21.
Yeah, and I could see if we had 25, 30 stores, 50 stores. We have very minimal stores. I'm just going to go to Southbridge or a neighboring community to buy them.
If I may, and part of that reason may be because the new legislation just went into effect in January. So some of the children may have had it, but it was maybe 18 to buy that product then.
Right.
So now that it's 21, I think there'll be a trickle out period for that. But yeah, it's going to be more difficult for the underage to get it because it is that 21.
I think it's, if I may, Mr. Chairman, I think it's the fashion to say that we're going to eliminate vaping. Well, I'd like to eliminate smoking cigarettes, but if someone to me said, I have a nicotine addiction and I'm going to vape instead, I think that's a better alternative than it is to smoking cigarettes. But if you eliminate that, they're just going to smoke. So is that a better way or for their public health?
Well, we're not talking about eliminating, with all due respects, we're just talking about not being able to buy it.
Yeah, you'd
unless-
eliminate it.
No, you can buy it in the marijuana store.
Yeah, but then you're encouraging people to go to a marijuana facility to get vaping materials, and you're eliminating someone who's trying to sell it down the street who doesn't want to be associated with marijuana. So you're kind of associating the two together, the marijuana and the vaping. I'm not sure if that's the right message you
Well,
want
I'm
to
not
send.
sure either, Jim, but I think it's worth looking into, and I guess at the very least, what I'd like to do is put this back on our agenda for maybe in September when school starts, or possibly October, to see if there's been an increase or decrease, or what's been going on? Is there some way we can make a determination as to whether the vaping is increasing from February of 2019?
Yes.
We can certainly do whatever the board wants. You wanna eliminate vaping and put it in a marijuana store, but we don't wanna encourage opening a marijuana store so we can sell vaping products. And we don't have any stores right now that are selling marijuana, and I don't foresee it happening for quite a long time.
Well,
Me-
I'm kind of backed off from that, Jim.
Okay,
So what I was suggesting was that we put it on our agenda for next fall to see, put the issue of vaping on the agenda for next fall. Just to see whether there's been any changes.
I did get the cancer rates for Charlton, which, they sent to me, and they're down in a lot of cases. Every couple of years or every year, they send out the not marijuana, but the cancer rates for Charlton residents based on data that they have, and it seems to be decreasing. I think I did send it to all the board
got it.
members.
Yeah, we got it, yeah.
So, and it's a thing, but I think that it'd be we could, if the board decided, eliminate the vaping, but then you'd have to have a clause in there that it would only be sold in a certain,
I
you know.
already backed off from that.
yeah. Okay.
I have a question.
Then it wouldn't be sold anywhere, because it doesn't matter to
Let
me.
the
I
record
backed
show.
off.
that Kathleen
Until
is-
next fall.
But
But I will be back.
But they will be selling vaping, when you go to the marijuana thing, which is under the Cannabis Control Commission, I'm not sure if we can eliminate, the vaping products for the medical marijuana, it's part of it, is what I'm saying. They will be selling vaping materials for medical
Right.
patients, so I don't think we have authority to eliminate it, for medical.
I'm not suggesting that we eliminate it, period, at this moment.
I have a
got that
question. I have a question. The vaping for tobacco, nicotine, whatever, is that the same type of instrument, whatever it's called, the pen or whatever, that you would see also in marijuana facilities? Do you have any idea? 'Cause I
I'm
don't-
not, for sure, I haven't seen one of the marijuana, some of them are sticks, they look like a pen, some look like would be a thumb drive.
Right.
They're a little bigger. I did end up taking pictures at the stores to get an idea of what they look like. It's hard to determine what they are. If they were carrying you in your pocket, you wouldn't even know what they were, but they have quite a bit of a selection and all different types of flavors, and it cannot be out, as we discussed, for anyone to touch that's underage. They have to be locked behind a cabinet if you wanted me to show your ID before you purchase them.
I just have a general question, Jim, it's for you, but I don't know
Yep.
if you know the answer, but do you know, as Charlton bumped its cigarettes to the 21 as of January 1st,
Mhm.
correct? Do you know if Dudley did that, or if Dudley's playing by the grandfather rule?
I did speak to Tom. I believe there was only one community that did that, and I'm not sure it's one, but I don't believe it's Dudley, because Webster and Dudley and Southbridge went to 21 right away. I know Southbridge is 21, we're 21, Auburn's 21. I just had a conference call today. But I know there's one community that allowed it, but I'm not, Matt,
I was just curious.
there is one community that did, but I'm not sure of the community.
And to clarify, Jim, when you say one community, this is in an area, is this Worcester County, southern Worcester County?
Would be Worcester County,
Worcester County, so that's the largest county in the state,
74
So this-
municipalities, yeah.
74 towns.
Yep.
Okay, so that tells you something,
Hmm.
that people are serious about that.
Yeah, it is, and you know what, I'm not for tobacco, I'm an anti-tobacco person, I'm not for any kind of smoking.
I'm not
It
either.
appalls me when someone's next to me, and I'm there with my family, and someone decides, just because they're outside, they're gonna light a cigarette, it's just, and even if they're vaping in line, I just tap them on the shoulder and say, put it out, please.
There you go. And then show them your credentials,
No, I
especially
understand
in
that.
town.
Please.
So, I'm sorry, go ahead.
No, it's a situation where I think all of the municipalities decided, and some stores on their own decided to go directly to 21. Even if the boards decided to do this tiered, they were going right to 21 because they don't want to sell to. It's too difficult to make a mistake if it's tiered. You have to have this calendar with a date up there. If you're born on this date, you can. It makes, when you have a cashier that's there that's young, it's very difficult to make a mistake, and then you're subjected to fines and then loss of product. So.
So between now and whenever we do get this on the agenda, and Kathleen, I'm with you on this, I think we do need to continue talking about this. We can do some research. I spent very little time on this, probably an hour or so, looking at some of the vaping stories and concerns. I was more concerned with people under 21 getting hooked
Exactly.
on nicotine, which then they would be hooked for the rest of their life. Along those same lines, remember in the 1960s, about 50% of adults were tobacco smokers, and now I think it's about 23%, give or take a small percentage, which is good. And one of the reasons why is not just because of the education, but because the cost of a pack of cigarettes or a carton of cigarettes has gone up. And the states have been putting on additional taxes as they go. And I'm all for that. So I don't know, this is something we can look at in the future. And I'm not saying we can put a tax on vaping, but I still don't understand how the vaping equates to a pack of cigarettes. Is it cheaper? Is it about the same? Because the way to discourage it is to hurt new users from taking on vaping if it hits them in the pocketbook hard. And you know, it's sad
I'm
to
not
say
sure
that
the
sometimes you
cost.
have to do
I
it.
didn't, that's one
Well,
thing I didn't look at, so.
I saw it, and they said $13
I know the
for.
cost is $40 for the starter pack with Juul. We both have kids in the high school. It's an epidemic in the high school. I have a son in the middle school. It's in the middle school. I don't know if any of you have spoken to the school nurses. That might
speak
be a
to
good
this-
idea.
The school nurses have to report to me any kind of illness, anything that's subjected to.
This isn't really an illness. This is an epidemic.
No, but it's an epidemic, but it does affect health, so they have to. But the Dudley Charlton School District, Jamie Terry, who is doing some of our work for Title V with the loss of Jim, is on the school committee, the Dudley, as a Charlton representative. She said they're taking it serious, as I wish to adopt the same policy as Bay Path and have those detectors, but I think it starts at home too.
Well,
Where are kids getting $40 to buy this? That's expensive for someone to.
True. The kids get it from other kids.
Yep.
That's how they get it. And then those kids probably get it from adults that bought it in the store. So it's the same way that people used to get alcohol, right? I mean, they get it
Sure.
from other
Yeah,
people that
yeah.
bought it for them. But in the school, they're doing a really good job educating the kids. I do think about it.
Yep.
They've had different nights about it. They send flyers out. There's stuff on their social media about it. So they're doing a good education campaign there. But I do think it's quite an epidemic. It's worth looking at. And like you mentioned, Mr. Sanborn, the bigger issue is this is Philip Morris and company, or the other big tobacco companies, coming in and taking a grab at the younger kids and saying you can hook them for a duration.
For
right?
life.
This is our revenue stream here.
Sure,
Yeah.
sure.
And the other thing that you may or may not be aware of is the device itself is tiny, like you mentioned. It looks like a flash drive or whatever. And that thing heats up with little coils, a liquid cartridge.
Yep.
These tiny little cartridges that come in different concentrations. And not only do they come in different concentrations, but they come in different flavors, and they also come in THC versus tobacco. So they extract the oil, they put it in the cartridge, and the oil has a much, much higher concentration than anything you'd see in a cigarette. That's how that all works. The thing heats up to like 400 degrees to make the vape, which is a vapor that the kids then inhale. It's really bad for you.
It is. It's dangerous. I mean, I'll keep an eye on it. I only have a few stores to enforce. I stop by constantly. They know they're not going to sell to anyone underage. The thing is, someone buys them for someone else, and then they sell them to younger kids, and that's the problem. And if we didn't, all the towns around do sell them. I think Webster, like you said, eliminated the flavored, which they're all into the. I don't know. There's so many different flavors I couldn't even count them.
And growing too,
Yeah.
from what I read.
Yep, and that's something that they're right. They can add the THC to that, and you wouldn't even know. I mean, they're doing all kinds of stuff, but
It actually kind of smells nice sometimes. I walked through a cloud of it. I was so embarrassed. I said to my kid, like, "Oh, it smells perfumey." He goes, "Mom, it's that guy vaping the blueberry over there." I'm like, "Oh." So embarrassed.
they do. That's their way of attracting and not causing a nuisance to people. But I'm not for them in any way. You know, the vaping, but
So, through the chair, other than putting it on the agenda and doing more research, is Is there any other action items that we can take?
I was thinking about putting something on our website, a video. I'm assuming that there's already some sort of government video about, just short,
We're
a
looking-
minute or two.
We're looking for one. I'm trying to look for the one that Comcast has, a short video that is really targeting young children about the dangers of vaping. And I don't know if it belongs to the CDC, but I'm gonna try and find out tomorrow. I have a class in Marlboro with a food safety update class, and I'm gonna ask some of the other health directors if they have any anything we could use, or know of anything that we could use, because the state will be there teaching the class, that if we can get any materials that we can put on our website, because we now have control of our own website, the changes in the town, we can actually control what we put on it. We don't have to go through Lisa Westwell and wait for her to put it on. We're actually going to be interacting and changing. Our website can change often.
Our board or all boards?
All boards.
All boards,
Yeah.
okay.
Not
Okay.
yet, though, it's not in place.
No, it's working on it, and Kim and Andrea are working on it and making sure we update. And I think that's something, but I'm not sure, I wish we had a counter that would show how many times people visit the Board of Health website.
It's Kathleen going on there every hour, 'cause I'm kidding.
No, I think there's gotta be I'd like to put it on like maybe the Charlton channel,
Yeah.
and get it on a more of an audience, or someone suggested the selectmen, the person does the town channel, he does.
Dick Vaughn?
Dick Vaughn, and have maybe Dick Vaughn do something on that. They'd like me to go sit with Dick Vaughn and talk about the dangers and do some community outreach, and when you're a board member also, remember we discussed, they discussed it maybe, I think you brought it up.
Yeah.
I'm not sure,
Yep.
but, yeah, I mean, that's
It
another
needs,
thing
we just need to get a bigger target audience.
Well, I'm suggesting then that we don't wait until September. I think we move vaping from new business to ongoing business, and
Yeah.
because we're meeting on average every 3 to 4 weeks, so September will be here.
I think we should keep it on there. And
Yes, we should. And then
Okay.
as you get something, we'll have it on there. You, Matt, Jim.
And I will,
anybody.
with your permission, Mr. Chairman, I will contact Cheryl Sabara, who does the Mass Association Boards of Health, and ask her if she has some kind of verbiage for the elimination of vaping. So if you wanna take a look at it in one of your meetings, doesn't mean you have to, but at least you'll know what we have to do if at some point in time you want to possibly eliminate the flavored portion of it, or do whatever you want. At least we'll have a legal opinion of, in the language that we will have it ready.
One other thing, Jim, along those lines, if they do have any of these little brochures you see out on the table
Mhm.
by the Board of Selectmen's room, if there's anything that the state of Massachusetts or the CDC, you said,
CDC.
anything like that that we could get, hopefully free, and distribute. I don't think the kids are gonna pick them up, but the idea is to get to the parents, to make them
Parents.
aware, and hopefully keep kids from getting addicted.
So one of the suggestion is that if, Jim, if you do go on the TV show with,
Mhm.
Dick Vaughn, maybe somebody like Kristen Castigian could go with you, because she's got a lot of knowledge, and just,
You know
she
what?
just
She's
said-
also much better looking than me, so I think she'll be
But
better.
you
Wow.
could, you could both go and present it from different points of view.
Yeah,
I
if
think
as a
that-
family with children are using it, and on the health side, the dangers, I
Yeah.
think we need to also go right to the tobacco issue also.
Yeah.
Not only
So-
just vaping.
Would that be something you would do,
I would
Kristen?
certainly help. Yeah, is there any chance that we could stick a blurb in the town meetings coming up? Like, couldn't you just stick a flyer in for all the people that show up at that and be like, here's information?
Well, I think the selectmen may talk about it anyway. We did meet before the selectmen,
Last week.
Matt, Kathleen, and myself, we did talk about vaping and what we can do as a community to get education out there. I think it was just a start, and I think that's why we need to have a continued discussion of where to go. I think the school committee and parents all need to know. And I think Bay Path, like Matt said, that's in the zero tolerance. If you get caught vaping,
I agree, but that's $1,000 per detector, so not every school's gonna afford that.
well, I'm sure they'll send the bill to the town of Charlton and Dudley, so.
Well,
No,
that's
sure.
an idea to put a flyer into the town, or have somebody standing there and passing them out
Or
and
even
stuff.
in the Villager, a blurb, from the health department.
Well, maybe there's some of this marijuana money that was given for dangers for education, seeing you can put THC in it, maybe we can use some of that $50,000 that's coming from Green Gold Group. Which I don't know where it is, but supposedly, there was some money that was supposed to be for education.
Okay,
Well, I'll run it by the selectmen and see if we can do something like that, if that's all right with you.
sure, fine with me. Anything that'll help.
Yeah, I'll contact John LaFleche, Superintendent of Bay Path, and ask him for where did he get them, and if he could give us some information on them.
Sure.
I can forward it to you.
I think they've got questions.
Yes,
Hi, Noreen Johnson-Smith at 136 Dresser Hill Road. I worked at the Department of Public Health in Boston previously, and we've had a robust Massachusetts tobacco control program for what feels like 20 years in this state. And on the Mass Association of Health Boards website, Charlton is identified on a map of one of less than a third of the communities in this state that have no regulations relative to tobacco. 2/3 of the communities have adopted regulations around marketing to children, display and availability of retail shops that carry flavored tobacco products. There's a whole list of other policy actions that a health board can take to impact youth access to and use of tobacco products. But Charlton is listed as
It's
not
incorrect,
having done
because
any of those.
we've been belonging to Tobacco Coalition for past, I don't know, 15 years.
Yeah.
But she left. The person who was director of the Tobacco Coalition left. And when she left, when they emailed all the communities, they forgot about Charlton. Charlton was eliminated from it. So I asked why they didn't send it to us. I think her name was Smith, Mrs. Smith. She ran the Worcester Tobacco Coalition. She left, so someone else took it over. We were eliminated from that and missed the boat. But all that was included in that was only the stings, the tobacco stings in the store, which they've done, because last year I wrote a ticket to three or four tickets for violation of selling tobacco. And we just adopted the tobacco law to 21 also. So,
I understand, but it's regulations relative to the availability and retail sale of flavored tobaccos and other things that contribute to youth use.
Mhm.
So it's in addition to the stings, which are enforcement activities.
yeah, the stings were before vaping was really getting to the point where it's big. I think marijuana certainly pushed this vaping thing forward a little quicker. And I think that we don't have any marijuana sales in Charlton right now. I think they're stating they will be opening, but they have to comply with DOT regulations, and they have to they have to tie into the water line, so it's going to be quite a while.
if there's some material that you do have, please forward it to Jim.
I know what she's talking about. I've been on that.
Oh,
That's
you can forward it to all of us, and I will check that out, because I hadn't seen that myself.
I
So
think
thanks
Noreen
for-
would be a better person to speak on that. Absolutely, well qualified.
Great, would you mind?
I'm sorry, I missed what
She
the
walked in.
invitation
She walked in.
was.
She walked in late.
Originally
No,
to
you'll be on
speak
TV,
on
it's okay. Just
the
say yes.
public
Yes.
service and on that topic, and you're
Regarding
much
tobacco
more, you're much
control,
more
there are so
qualified.
many people that could contribute to that conversation. I mean, it really has been years and years and years that we've been taking action. And I heard the Board of Health at the Board of Selectmen meeting say, well, there's really nothing we can do as a health board to stop youth from using, but that's really not true. You have regulatory authority, and you are the only board, in fact, that can make changes that would help control the spread of tobacco among children.
Yeah, but if all the communities around you, Mr. Chairman, if I may, don't all work together, because I belong to the steering committee, which is 74 communities. I'm the vice chairman. I belong to LSAC. If we don't all work together, they're just going to go to the next town. So we can do what we want in Charlton. We only have 4 or 5 stores in Charlton that really sell tobacco. Is that, yes, we can eliminate tobacco in Charlton. That doesn't mean you're going to eliminate the tobacco issue if the neighboring communities aren't the same.
That's correct, but it is not a reason to not take action as a community if it's something of a public health concern. And eventually, communities catch up with each other. And right now, 2/3 of communities have at least one of 5 different forms of regulations of tobacco that they've adopted. So there's no reason for us to not participate.
Yeah, I agree.
I'd just like to make a point, like Steve Corona, 17 Old Worcester Road. About a year ago, we had downstairs, we had Sheriff Lou Evangelides come in for an anti-drug program. and we had 25 eighth graders, Leos and Boy Scouts, and one of the first questions he asked was, who knows what juuling is?
What?
I didn't even know what juuling was. Juuling is
Juuling?
vaping.
Okay, yeah.
Every single eighth grader, it was all middle school, eighth grade kids, raised their hand. Every single one of them knew what it was. And then it started a conversation on the way home. My son, he's like, Dad, yeah, they get suspended, detention, kicked off the bus. They're vaping on the bus all the time. So I think for a barometer, rather than ask the nurse whether there's a problem in the schools, ask what type of detentions or how many offenses from vaping happen. I think you'd be surprised by the number. Every single kid, eighth grade kid, raised their hand, they knew what juuling was. The adults in the room were sitting in the back, we didn't know what it was. And juuling was that most common sense of vaping.
It's like cleaner substitution.
And if you go into the Honey Farms out on Route 20, I wanted to take a picture and send
I
it
have
to
them.
you all. Do you? Of the
It's a big,
display.
colorful glass display about 6 feet high with,
And at child eye level
yep,
of all of the flavored products.
they're all there.
Yep,
Yep, I took
Is
pictures
it
of
Honey
it
Farms?
at Honey
in
Farms.
Charlton.
Every single store, I took the pictures of where everything was and made sure it was behind in a lock so it's not accessible. And like I said, this is, to me, it is new thing. It's attracting the wrong crowd, but so is tobacco. And tobacco's been legal for a long, long time, and I'm not for tobacco either. So if you're going to really worry about people getting addicted, I think you can start with the vaping, but you're really going to ban tobacco, and that's the thing, because the commercials that I've seen said that you're 4% more likely to, if you vape, to smoke. And I don't know if you've seen them on Comcast, and they're like Muppet. It's like a Muppet commercial, and I'm trying to get access to that, but it's certainly they're really running it constantly. So.
There was a couple more questions.
Yes.
I was just gonna say, the kids will tell you that nobody smokes. They'll tell you only old people smoke. The vaping is that generation. So I don't know, I would worry more about the new trends.
Yeah, I'm not for the vaping at all, and I don't think that, but I think it starts at home too with the children. You check their
I totally
backpacks
agree.
and
I totally agree.
make sure before they leave they don't have these things to bring to school. You know,
But like Steve said, a year ago, parents didn't know what juuling was. right?
I didn't know what juuling was.
Every eighth
I did
grader,
not.
every kid did.
Yeah.
We were shocked by the.
Yeah.
Once you have kids in the middle school and high school, you will know.
Yes.
So the Mass Association of Health Boards has a map of the state that shows communities that have adopted regulations on tobacco retail. It includes 172 communities have a ban of tobacco sale in pharmacies. 112 communities have a cap on the number of retail licenses to sell tobacco. 186 have minimum legal sale age of 21. Some of these are outdated policies, but we don't have anything in Charlton. Restriction on the packaging of cheap cigars, 164 communities have restrictions on that. Restrictions on the sale of flavored products, 124 communities have passed bans on that. And 133 out of the 351 cities and towns have no retail tobacco policies, including Charlton. And this is the Mass Association of Health Boards Tobacco Control map for the state. So you can go to their website and look at it.
Thank you.
Yep.
Yeah, I wasn't aware of that, thank you.
Yep.
So we'll keep it on the agenda and maybe we can start adopting some of the regulations.
Whatever we get from meeting to meeting, I think the more information we have, the better. And if there's something that we can do to get some kids from not starting this, I think it's somewhat of a win.
I will call. I'm sure you know Cheryl Sabara. I will call Cheryl. I'm very good. I talk to her all the time. Ask her, like I said, to get some kind of draft. But as far as Charlton's not a big metropolitan area with tons and tons of stores. Doesn't minimize it any, but there really are only 5 stores. The Honey Farms you're at, the one that's next to it, Ted's. Then we have the one on the corner of Oxbow and the Country Farms. That's it.
Did you include Food Mart?
The food, and the Food Mart, and then also there's Swifties that just opened last week on 169. That it just got their license from the state.
There's also a Massachusetts clearinghouse which has free materials that you can order by the hundreds, and they'll ship you a crate of materials to
That's where we got all
distribute.
that, those 2 boxes are full.
Right.
We ran out, we called, within 3 days, they shipped us another
Yeah,
50 for free.
They have a ton of variety of materials aimed at tobacco education for you.
The town's having a health fair, Mr. Chairman, soon, and we'll be participating in that April 30th, I believe. And that's when I think we can bring some of the vaping stuff, because a lot of the adults and parents bring the children. It's at the library, and we'll have a booth set up, so
Good,
if anyone's around on the 30th, you want
I
to.
should be.
Well, the other thing,
One
Mr.
second.
Chairman, I'm sorry.
No, go ahead.
The 27th of April was the Earth Festival here on the Common, and it might be a good idea to have some kind of a table there with information, anti-vaping information. Maybe something colorful. I don't know, I'm just throwing this out to the community. Maybe some kind of a colorful thing that would draw kids in, and then
And then scare the heck out of them.
Scare the heck out of them.
Tell them what it's gonna cost them for a lifetime of nicotine addiction.
Right,
What it'll
right.
do to their
I think-
brain.
I think when you disguise the odor from vaping with all this blueberry stuff, and
Right.
now we're getting into the marijuana oils and all the other things, the reason that's so attractive is I was in Florida and someone was smoking, vaping marijuana beside me, and it smelled like blueberry.
Okay, but it was marijuana,
But it took a little while for me to really get the distinct smell.
right?
Even
Get
though I was a
high.
kid. And, but as we're heading down that road, the vaping is a definite, first stop that we have to probably slow down before we jump into what we.
Mr. Jordan.
John Jordan, 68 H-Foot Road. I know our board is not comprised the same way that Southbridge's Board of Health is, but I know they have a ton of subcommittees. I don't know if we could have a subcommittee that includes some of these people who know far more than I do, and a Board of Health member to sit on it that concerning just vaping, just to investigate a bunch of options that we could do as a town. They could be putting it all on Jim and all on the board that meets once a month and giving you guys a ton of work. Maybe if some volunteers would create a subcommittee that reports to the board. I don't know if that's a possibility because of the way the board's made up or not, but is it something we can do?
Well, we, through the chair, we do
Yes.
have we do, one subcommittee that we do have is the recycling committee, and they've been very active for the last 5 years. This board formed that recycling committee, so there's no reason why we couldn't add another committee with residents.
Yes.
I'm Kristen Kasakian, Carroll Hill Road. The type of regulations that Noreen mentioned, is that something that a town meeting votes on, or is that something that you guys can just adopt on your own? How does it work?
The board can adopt it on their own during a regular meeting.
Oh, yeah.
And the only regulation needs to be posted for a change is Title V. You can't just arbitrarily post a meeting and say we're gonna change Title V. You can't do that.
You
But
guys
if,
can do
but so if they wanted to, at a meeting, ban, and as long as it's legal, because you do have to check with legal, because if you're gonna make a regulation, you need to make sure you put the wording right and correct. But then it is also, and then you'd have to notify all the stores, they have to remove all these things. So, but I think it's more that if they're gonna do that, also, we should have control over if they're gonna sell medical, if there's vaping in there also, that would be included. But I'm not sure if the Cannabis Control Commission, if we have authority over that, because it's medical.
But to my mind, if I may, I think what you're talking about is commercial, regular tobacco flavored vaping.
Yeah.
And leave the marijuana facilities alone because they're gonna be.
I don't know, I think we should look into it. I
Oh,
think
yeah.
we can't be,
Right.
but I think that as far as, we've had tobacco stings in Charlton, and like Matt said, we've had very few violators over the years. The state would come in and send an underage kid in and with a police officer outside, and then they would actually send the cigarettes here, and I would go over and issue a 21D, which is a ticket for the first, second, and then subsequently a third violation. We've never had a third violation. There was only one place that has been twice in 1 year, and that's was a mistake that was corrected. So I think that they do sell vaping here at that store. So there would be a total of 6 but one of them does not sell any vaping products, but tobacco only. So the Honey Farms is a huge display. Country Farms Charlton Food Mart has a huge display, but I think they're gearing up because a lot of it's paraphernalia for marijuana, bongs, pipes, all kinds of huge water bongs and stuff. So I think if we're going to do some regulations, we should look into doing the paraphernalia portion of it also.
Good idea.
Didn't we just pass a bylaw at town meeting about paraphernalia and it had to be in marijuana stores only? Pretty sure we
No,
did.
if you have a retail sales tobacco from the state and from the local board of health,
That's what it was.
you can sell those products, and that's the only people that can sell those
That's
products.
what it was, you're right.
And there's a lot of them.
And
So-
we're back full circle to where we started this discussion. And, we decided to hold off on it, but, I think your idea to form a subcommittee is probably the best one. And then the committee can present to the board some ideas for the board to consider. Because it sounds like there's more out there than I was personally aware of before this meeting.
Yes.
And not that I'm not for going to another meeting, which would bring me to another meeting, because I belong on too many committees, is that this office, we're currently researching the vaping, getting materials going. I've been going back and forth to the stores. I think the onus would be to get information to the board, which I can do on my own, because we have very few stores in Charlton, that you could make a decision based on the legal opinion. I would get some information from Cheryl Sabara, and you could make a determination whether you want to ban the product altogether, if you want to ban paraphernalia, if you want to ban just a flavored, and that's something you could do. If you decide at a meeting, we can post it regularly, and you can make that decision. To form a committee and drag it out, I think, like you said, keep it on there. I know the dangers of vaping and stuff. We're going to research it. There's going to be a medical facility opening up on the corner of 20 and 31. And I think we should get ahead of it before the opening. If we can ban the paraphernalia there also, if it's for vaping, that means, like she said, if you can put the THC in that vaping, then if we ban it, they wouldn't be able to.
My head's spinning, it's coming too
It's
fast.
the same apparatus, it's identical.
Yep.
Yeah.
It's identical.
But, and as far as the flavored cigars and stuff, when I'm in the stores, a lot of kids come in and they're buying, like you said, those purple flavored tobacco, the cherry, and they buy them one at a time or two at a time because they're cheap. They're like 99 cents. And they buy a lot of them. He says they sell out all the time, and those are the flavored tobacco products. But you still have to be 21.
But it's still getting into the hands of
Middle school.
Yeah.
Yeah.
Right.
So
They're easy. They're in a package. They're this big.
Yeah,
Just
so somebody's buying them in a packet of that, and then they're marking it up and making a little money on the side, even though highly illegal. But I'm not surprised. It's somebody mentioned.
I don't think-
just like alcohol sales used to be.
Yeah, and I think that if you could work with other communities to work in conjunction, but if they're just gonna go over the line and buy it from someone else, now you've eliminated it in Charlton for the very few stores we had, but now they're just gonna go over the line and get it somewhere else. So I think it needs to be a group effort, and that's something we talk about at the FEP steering committee meeting, is what can we do as a region, of the largest region in Massachusetts, to develop anti-tobacco, and some of the boards just aren't for it. And when you're dealing with, 74 different boards, and most of the boards don't agree with banning, I've brought tobacco before this board before, and they had two smokers on it, they didn't wanna hear it, they didn't wanna join the tobacco coalition. So, but we have been.
3 non-smokers now.
Yeah, former smoker.
Who don't even vape.
So, I understand what you're saying about they don't list us on there, but it's certainly, we've been, as far as, we don't have any regulations, to be honest. We have some marijuana regulations, but as far as regulations, I wrote them up a long time ago, and we did.
Before vaping was even a word.
Before vaping was even there. There were more regulations of idling, way to ticket people. If you have regulations, you're allowed to write 21D, and we never passed that, but I still have those. But as far as, it didn't include tobacco, but we did just vote to go to 21. So now, anyone who was 18 now cannot buy tobacco, cannot buy vaping materials, you must be 21. So it's very difficult to control where they get it.
Mr. Jordan,
So I can be clear, the board has the ability to just ban selling the products altogether in the town?
right, we
Yep.
could ban tobacco sales.
Like
if we
next
want.
meeting, you can post
Yep.
that, next meeting, you guys can
We
vote on
could.
that, and it's out of the town.
Yep.
I'd be willing
Well,
to go
that's
to
what they did
Southbridge
in
and-
West Webster last week.
That's right.
Yeah,
Yes.
I'd be willing, I go to Southbridge.
Webster
for
received a
meetings.
grant for that, so they,
I'd be willing to go there and say, we did it here, why don't you guys do it here too?
And I think, Jim, you were right when you said, you know, you need to get a little coalition, but if you can start small and go to there's 7 surrounding towns, Leicester, Spencer, Oxford, Dudley, Southbridge, Sturbridge, I'm missing one. No, that's not, I'm talking, well.
are you talking specifically vaping or eliminating tobacco?
Well, I'm talking,
No,
no,
just
not necessarily
vaping
eliminating
products.
tobacco, but trying to work to restrict the displays for what these kids are seeing, restrict flavored vaping, things along those lines, whatever we decide, and start small and just talk, so that people can't just go across the line. Now they've gotta drive 2 towns away, or 3 towns, or whatever.
But it
But
starts
if you're-
with one community.
Right.
Even if you just
Yep.
lead the charge in other towns, we'll see how well it
Correct.
works. and they
Right,
might copy,
right,
you know.
right.
Yeah.
She said it's not regulating it. I think if a 13 or a 14-year-old has to get on his 10-speed bike and ride to Webster to buy vaping products, well, that's
This
probably
is-
not the
this is
worst
a display
thing
of-
in the world. Yeah, right.
What you were talking about at Honey Farms. You can scroll down and up, it's pretty tall.
And I agree, my 15-year-old daughter thinks smoking is disgusting. I'm not so much worried about that.
No,
She
me
really
neither.
thinks it's
Neither.
disgusting.
Yeah, everything is
But
gross.
they don't think anything of vaping. All their friends are doing in school. They're all have challenges to see who can get away with it going down the hall. They all think it's a big joke and it's not a big deal. So
Until they realize that they're addicted to
if we could
nicotine,
just
which
get rid of
is
it all together in the town, I'm all for that.
very difficult.
No, it rings.
I think I called somebody.
You did.
Relax.
I don't know, it's hard to see, but I
I'm
think this
surprised
is
it wasn't me, because
I think this is what
I don't
we're
even
talking
carry a
about
cell
and what you
phone.
saw.
He just got
Yes,
one.
absolutely.
you can see the display.
Oh, no, I
Very
see.
colorful.
It was,
Nice
Pretty,
big
yeah,
color.
it's like cooling, it's like cooling.
And that's only a portion of it. It's huge, so.
I see it, I haven't seen it, thanks.
So, this is like the largest display of any product that they have. It sounds like, if it's 6 feet tall, I have yet to go into a
That's-
store and
That's one of the smaller ones. But as you can see, it goes on the whole front counter.
how wide is that? Like 10 feet, 12 feet wide?
It's about 10 to 12 feet wide.
They might as well just put up a billboard there, you know, here, don't leave without giving us some of your money.
And that's another one from another store. So,
Yes, Kathleen?
So, I'd like to make a motion, and I'd like to back off from my backing off, which I backed off from half an hour ago.
Can I write this down? Backing up.
I'm not saying anything.
I'd like to make a motion that this board, consider banning all vaping products as Webster did, in the same method that they did, which I don't know what that method is, but I'm sure we can find out. I guess I'd like to bring it up for consideration to ban it at our next meeting.
Matt, your thoughts?
Personally, if we're gonna do a regulation, I think we should take maybe another meeting's worth of investigation. Let us go on our own for a couple of weeks and see with our own 2 eyes, because if we're gonna consider banning anything, I do think we should think about that paraphernalia and the bongs and all of that. I think that's, sending a bad message to the kids, and, quite frankly, people that are offended by it have to go pay for their gas, stand next to a 3-foot bong. I mean, I don't know. But I just think that we should look at the whole picture, including the vaping and some of that stuff, and take that into consideration. Because I personally don't know enough about it. I go with my blinders on. I don't.
Yeah, I haven't seen this until Jim just showed it to me. So I'm walking into the stores too, and I'm not looking around.
That's why for me, I kind of want to, even if it's at, my limited area where I go and see with my own 2 eyes. I mean, certainly an awareness. But even those displays, yeah, I've seen those displays. For all I knew, it was
You're right.
cigarettes. I don't know. I don't look at them.
you're right, I didn't really look.
Yeah.
I paid more attention, but I think Matt's correct, but it takes a while to write this up properly. It's not something you can arbitrarily just, but I think we can do it at a regular meeting, but I think we should include the paraphernalia in there. If they're gonna take it out and they have 6-foot glass bongs with and all that other stuff. It just doesn't look good. And they're doing that because of the anticipation of the retail marijuana store that would open up.
So Kathleen, you had a motion, and in asking me, I don't know about the motion yet, but I'm just saying I think we need to, as far as this discussion, I personally would like just a little bit more time to see it. And I'm not saying yes or no for your motion.
Well,
But
the motion is to put it on, is to put it on the next meeting, to seriously consider banning the paraphernalia. I had brought it up earlier in this meeting, and then I backed off on it because there didn't seem to be any reason to go forward at the moment, but I've heard a lot of testimony tonight that has changed my mind. And so what Jim just showed us is very disturbing to me, and I for some reason haven't seen it, just like you. I don't see it.
So I would second the motion for consideration to talk about it at a future meeting. I don't think myself I'd be ready to put the regulation in at the next meeting. I'd like at least maybe one more meeting so we could, as a board, have a discussion one more time on this before
Okay, as long as-
regulation.
As long as we're moving forward, I'm
Yeah.
happy with that.
I'm with you on moving forward. I think I agree with both of you. To get it at the forefront, put some time, spend some time, do some research together. Jim, whatever materials you do get from Cheryl Sabara or.
I know that she takes a while to get back to me, but certainly we're gonna need someone to draft it up, a
Right.
letter. So and then you're gonna have to review it, and you're gonna have to give a comment period at the meeting, but you can adopt it at a regular meeting, but like Matt said, give me some time to
Yeah,
get
that's okay.
the documentation together so the board can accept it, so it looks good.
Go ahead. No, go ahead.
Thanks. I just kind of want to know, like, what are our options? Okay, yeah, ban it all together, that's one option, but can we, as you were discussing, maybe, do just the flavor stuff or just the paraphernalia? What are our options as far as what have other, regions done or other towns done?
I think Webster just eliminated the flavored.
Correct.
They didn't do the whole ban on vaping. They just did the flavor,
They
correct?
restricted flavor to adult-only tobacco outlets because they already have a ban on tobacco being sold in adult-only establishments. So they have regulations that provide for the sale of the flavored things, but in adult-only establishments. So they're restricting it for below 21. That's different than the paraphernalia question, but Cheryl Sabara is a legal expert in this
I've known
field.
Cheryl for 25 years, so.
And I bet she would come and do or send folks to do a full presentation. And they also have a legal library on the Mass Association of Health Boards where you can look at
I
what
was
other
on it today.
communities have done.
Yeah. It's, the board can do it. I think certainly getting the right wording and what you want to do to make sure it's correct.
Mr. Chairman?
Yes.
Could we ask Jim to reach out to Cheryl to see if she could, in fact, send somebody to give us a presentation? Because I think that would be.
I can ask. I've asked her in the past, and she's overwhelmed. She's
Busy.
short-staffed and overwhelmed, so she could. I know she was supposed to come I was invited to some meeting, I forget the topic of discussion. She could not make it. She apologized, but she's one person, she's short-staffed, but I think it'd be easy enough for her to give a boilerplate like she did for the marijuana. She actually wrote up boilerplate regulations that we adopted for marijuana facilities that, you could just change from any town, but a lot of towns accepted as we did, because I think we could get something from her for that. If not, Webster, I don't know, Webster didn't fully do what I think this board wants to do. But I will get the options and see where legally we stand. Are we able to, remember this has to go to if the Attorney General says it's not legal, you can adopt the regulation, but we want to make sure it's enforceable. Because we have to tell all these stores, everything's out. So, and you have to give them time, and we need a time period of when it has to be out of the store.
I think it's a step in the right direction.
Believe me, I don't want
Because the
children
more that-
vaping leads
Yep.
to smoking. It's not.
And the flavored is It's certainly something that's catching.
People
their
say
eye.
that flavored, Mr. Chairman, people say it's not flavored, is not harmful. I've actually transported a patient in an ambulance who vaped all night. They had a vaping party, and he was unable to breathe in the morning and had to be intubated. So there are conditions where it can overtake your respiratory system and cause you respiratory arrest or distress. So it does happen. I've witnessed it firsthand.
So I'm sorry, go ahead.
I was just gonna add that if Cheryl can't make it, perhaps someone from the City of Worcester Board of Health, because last year they banned flavored tobacco products as well.
Yeah, I can ask Colleen to come.
That'd be great, Jim.
She's acting director of the Tobacco Coalition now, and I meet with her once a month. So I'll ask her. Our meeting's next Thursday. I'll even ask Colleen to come because she's actually heading the Worcester Tobacco Collaborative. So.
So we had a motion,
Colleen Boland.
I seconded it.
okay? Do you have to get the wording proper for Andrea for the meeting notes? Or you want to restate
Yeah,
it, or
just to add vaping, possible vaping bylaw or
bylaw
regulation.
Regulations, bylaw.
Just so put that on the agenda, and I'll get someone here for our next meeting. Remember, at the end of March, I'm going to the Natural Conference in St. Louis, so I won't be here.
Okay. All right, so we have a motion, a second. No further discussion. All in favor?
Aye.
Aye. Unanimous. Thank you. I think that's a good
Yeah.
step.
Yeah, thanks, thank you. to all
Thank
of
you for all you people who showed up for that, and you're free to stick around. Nothing else on vaping currently? Jim, anything you get between now and then, please let us know, even if it's too big, you don't wanna scan and send it, whatever, just say, I've got something, a bunch of pamphlets or information. If you can't send it, we'll make it.
There's a lot out there. There's plenty, and it's free. You don't have to pay for it. So we're getting it for the health fair,
Mhm.
health and wellness fair that the town's putting on, and we need it for our table outside, and we'll put a packet together inside. We usually hand out bags with all
Do
kinds of
schools have
information.
these pamphlets? Not that
The
kids
schools are doing an educational program. I know Dudley Charlton and Bay Path has
Okay.
taken aggressive, but I don't know exactly what they're handing out. But the
All right,
schools.
but at least they're
But as far as
working.
asking who's suspended for that, I don't believe they'll give me that information.
Yeah, probably not.
No. But the
Not-
school
not who,
nurses,
but I bet they would give you the
The statistics.
Your number.
yeah, the
Yeah.
numbers. How many detentions, how many.
not who, but how the numbers. But
Right.
sometimes it's very difficult. The schools don't like to look bad, so they don't want that information
Something like this,
publicly.
I bet they'd be cooperative.
I don't know, you could just go for the chairman.
Yes.
Cheryl Sabaro recently published a white paper on school policies and tobacco control, so I mean, that is also available
Yep.
on the Mass Association of Health
Yeah.
Board's website, and could be a resource to the school department if they have not adopted anything.
If I may, I think Dudley Charlton has adopted something.
Okay,
Yep.
I don't know.
Yep. So,
All right. I think we're done with vaping for now. Thanks again, everyone, for that.
I think the problem is we're also regional, so we have to be in coordination with Dudley, because Dudley has a health director, Charlton has a health director, so they always invite both of us together to sit down and discuss the issues, which is,
If it affects the schools.
yes.
Okay, yeah, it makes
Yep.
sense. All right, moving on to ongoing business, Flint Road landfill. Jim, do you have anything new?
Yes.
Yes, go ahead.
Talking to Gary, as you know, Jim Malley was our third-party engineer. The DEP requires that anytime CMG does any kind of work, that require a third party to come along and do their own assessment. Of course, Jim lost his certification and now has passed away. So she would have to work for us. So we would be paying her like we paid Jim. And this is the woman that Gary recommends. And he looked long and hard and really did his due diligence to find someone who the board would be happy with. So that's the letter that I received. So we would need the board's blessing. And Gary really needs, for us to comply, to have that third-party operations person there.
And I'm sorry, I was reading while you were talking a little bit, but Gary has worked with this individual in the past?
Yes. But she would actually not work for Gary, she'd work for the board.
Correct. And this would just be for future third-party inspections of the Charlton landfill.
Yeah, it's,
Charlton landfill, old and new, both landfills on Flint Road?
Yep.
Okay.
it's required from the DEP when he does this. It's mandatory. So he looked long and hard to find someone. We made lots of calls, and Gary finally reached out and found this person. If you'd like her to come before the board, which I would recommend, maybe we could put her on the next agenda and you can meet her.
I have a few questions. One is, she talks about the rate of $60 an hour. Initial reports generally take 30 to 35 hours per report, I would imagine. These are quarterly reports or biannual reports? How does this
This
work?
is for the proposed post-closure environmental monitoring program. It's corrective action reports. There was site, I believe it may be 3 times a year. We only paid Jim, I looked into the records, when Jim did it last year, we paid him $3,200.
Okay,
So, and I believe he was at $55 an hour.
okay. So it's in the range. I
Mhm.
don't have a problem with that. We know Gary, we've been working with Gary Magnuson for quite some time now. Other board members, your thoughts, please.
I'm good, thank you.
My thought is, I respect what Gary has to say about it, and if he's comfortable with working with him, working with this person, I'm okay with that. But I don't think we should close the door all the way on this. I mean, I think we have due diligence to see other engineers and other pricing and whatnot for the town. If it's something that needs to happen sooner than later, I would go along with like a one-time report or something like that. And but I do think there's plenty of engineers out there. I mean, the price doesn't seem ridiculous. I just think due diligence to the town would be more than one, just going with one recommendation.
Yes, Jim?
I think when Gary and I talked about it, we tried to maybe coordinate with maybe who would be applying. As you can see, there's envelopes there for you to take home for, those have to be returned after you review them, and we have to keep them here when the process is done, which you want to post for the next meeting, actually your interviews for our Title V inspector. And those are the only 2 qualified candidates. But Gary looked, and we looked at both those to see if they were qualified, that we could actually continue as we did with Jim.
Mhm.
They don't have that certification. So Gary looked long and hard and could not find anyone, and he finally came across someone who has prior experience who the DEP recommends. So he said it was very difficult to come across this person, but of course this person would not work for Gary. They work, I as the director through myself and report to the board, but the board is the appointing authority for this person.
So,
Just for clarification, you're saying that, so, Matt's saying he'd like to open it up to more people, but you're saying there's not any more people?
Well, I'm not saying there's not any more people, but it was very difficult for Gary to find anyone that's DEP approved to be a third-party independent inspector. And that's one of the certifications that Jim didn't have in the end because he was very ill, and that Gary has been looking and searching and searching and searching to find someone who's qualified and has the experience. He thought that the board would be happy with this person, so that this is what was sent forward for me to forward to the board. But that certainly, I don't think hiring someone without speaking to them, I think if they're going to do work for the board, we should at least invite her to the next meeting and have her come in, and that way you can possibly ask questions. And it's not a lot of work. It's very so it's not going to be this glamorous posting of work to be done. It's just something that's going to work. And every time Gary would go and do the whole inspection of the landfill, this person would go along with them and report. Their own report would come back to the board.
this is required by the state, you said?
Yeah, DP mandate.
So Matt, are you suggesting then that we would have to post this, or not would, but we should?
No, I'm not. I mean, I wouldn't even have a problem if Gary could come in and maybe talk what
Okay.
his feelings are. But I'm not saying no to this person whatsoever. I think Gary's been leading this board in the right direction since
Sure.
day number 1.
Yep.
So I'm not taking away from Gary's reference whatsoever. I'm just hard pressed with somewhere he's saying, "Yeah, this is going to be our new person." Not
No,
saying
no,
that, but I'm just
no,
saying
no.
here's our new person, and I just say, oh, okay. I mean, I respect the recommendation, but is there anybody else? I don't know.
When I spoke to Gary, Mr. Chairman, for me, when I spoke to Gary, he said, I'm trying to find someone that the board would be happy with, and I'm trying to do my due diligence. So we asked Jamie Terry, who is filling in for Jim now temporarily until the board can appoint someone full. She doesn't hold that certification, and that's not something you can easily, I think, obtain. So Gary did some searching and actually, it should have been up, I could have looked. He said, I'll do you a favor and look. He didn't charge us to look for this person, but he felt he needed to get someone who was qualified for the board, but certainly it's not someone he's saying that he's just recommending this person to the board. So it's up to the board on what you want to do. It's your call. But he just has some work to do, and he really needs to get that third party person there.
So just, can I have one more question? So Jim, so the two Title V applicants that we have tonight
Yes.
can't do this work,
No.
simply, and
No.
there doesn't appear to be many Title V applicants that can do this work out there, like Jim Malley did,
Well, the problem is, when Jim Malley left, he left a void with 7 or 8 communities,
right?
because he did that
So
for
they're
7.
all
So
school
they've formed a 6 community coalition to hire someone. I'm not sure if they've had any luck yet. But you have to be approved by the DEP to do Title V and be a registered sanitarian or have the qualifications to even inspect Title V. We pulled the list from the DEP that's approved and people are already doing it, and the 2 applicants in there are highly qualified and meet those qualifications. So we did send, and you can see in your folders the paperwork and the process we went through in their application. And there was a couple other people that did apply that did not have the qualifications to bring them forward.
So getting back to Tessa David, is that the correct?
Yes.
It's, can we bring her in, and are you suggesting at the next meeting, have her come on in and?
Yeah, I mean, if
And
this,
what about Gary?
Or do you want
him to
Gary
come
here
too?
too?
I mean, yeah, I could call Gary anyways, and,
Yeah.
you know, just,
Sure.
he'll tell me where he's coming from or whatnot, and that's, you know, I don't have a problem with this at all. I just question, you know, is this our only choice, that's all.
That's a good question.
You're right, and I think that, and he said the $60 an hour was comparable, he's right with Jim, because we looked into it, what we paid Jim to do this. It's something that, I couldn't find the reports that Jim did though. So this person has to formulate their own report, send it back forward, so it kind of matches up, and the DP requires that, so, certainly it's up to the board. I think just Gary just worked hard and made sure he found someone who's had prior experience and he felt comfortable working with.
And personally, if we need something that's time sensitive and Gary's waiting on something, I don't have a problem doing it for this
Yeah.
quarter or this inspection. I don't have a problem with that whatsoever. I don't think the price is a ripoff by any means. I think it's probably, quite frankly, it's probably cheap. I just think the due diligence is to make sure that we can say, yeah, there's nobody doing it for, you know, you know what I'm saying?
Yeah, if you want, Mr. Chairman and Matt, I can have Gary come into the next meeting and explain his process. Would that be okay?
Sure.
And what the need is, the time frame, and how we came about, rather than have her come in. Maybe it's best to have Gary come in and explain, because he wants to talk about Burlingame Road and the test that's on the agenda next, and maybe we could have him come in, because he doesn't have the results in writing yet, and he's going to forward them tomorrow, a letter, but that's up to the board.
Does he have them not in writing?
Yes.
Can we
Okay.
talk about them?
We can, yeah, I mean,
If you're okay with this, I'll invite Gary to put him on the agenda.
put him on ongoing business first, so we're not wasting his time, especially, I'm assuming we're paying him too.
Yes.
So we'll put him first on ongoing business.
He doesn't always
Or
charge
new
when he
business
comes to
work.
these meetings.
I know,
Yeah.
but I don't want him sitting around for.
Sure, for
45
fire, he
minutes
lives
an
in
hour.
Tallinn, Connecticut, I understand.
Right.
But he did touch base with this department today and said that, and he called me personally and said, they look good, it's clean, came back clean.
Okay. Good.
He's just pending the written results that he's going to draft a letter with them and send it in tomorrow. But he'd like to come before the board.
Yeah.
and explain
If
this
it's all right with
and other
the board
things.
members, I would like to talk to Gary.
So,
We'll
Mr.
get
Chairman,
both things squared away. Yes, sir.
I'd like to table the discussion for Tessa David until we speak with Gary and
Good.
maybe talk about it at a future meeting.
And along those same lines, if I could just add to that, you mentioned that if something comes up, because we may not meet for 3 weeks or 4 weeks,
Yep.
if Gary needs something, we are allowing this Tessa David to, if the need arises, to
Okay.
do the work.
I'll
for-
explain
for
to him.
Gary. Yes.
If he needs to perform work before the next posted meeting, and we're not gonna be in compliance with DEP, please use her
Right.
temporarily until the board can sit down and discuss it with her.
Correct.
Is that correct?
That's what I would suggest, what Matt. I
We
just
don't wanna be
said.
out of compliance with the DEP.
Correct. Kathleen, you're okay with
I'm
that?
good with that, yep.
Okay,
Okay.
very good. Thank you.
And like I said, Burlingame Road, the water testing, the one address that did respond, very clean.
So where do we go from there, as long as we're talking about Burlingame Road water testing? This will be brief, I'm sure. I would hope.
I think that, this is the only person that responded. I think we talked about, we moved out, got with no response, moved out again, no response, and I think Matt said, well, what if this person who did respond kicked in the 500-foot anyway, and we didn't test? So we did test, and that's what Gary did, and it came clean,
Okay.
so.
Well, you know what, we'll talk to Gary next week.
Sure,
Yeah.
Not next week, next meeting, sorry. Not meeting.
next meeting.
Yeah.
Yes, next meeting. Okay.
That's great news.
It is very good news, to be honest.
And you know what? Kudos to this board for enforcing that.
Yeah, I seem to recall somebody who had the idea to do the testing. Brought it up a year or more ago. What would that be?
Maybe, but I'm glad this board
I was a
followed.
little scared when you did that. I thought, oh my God, this could be a can of worms that could cost the town.
I'm glad we followed through.
No,
with it.
I agree, you know.
Matt, you did it was a good thing. Matt was the advocate 10 years ago for this to make sure it was done, and we did it. And I think I had a short meeting with Robin today because she's going on vacation, and I told her that we did test the Burlingame Road, came out clean, and she was very, very happy. She says, well,
Yeah,
good,
me too.
kudos to the board.
Mhm. Good.
Of course, it came out clean, so, but if it wasn't, but it,
Either way,
but it
you wanna
shows
know.
that Charlton's doing their due diligence to make sure that the radius around the landfill is
Well, that's one anyway. But
So
we'll
what
talk
about
to
the
Gary
other
next
two?
week.
the
Well,
other.
The other two.
We were
sure.
gonna do
You're
three.
talking additional testing. We'll talk to Gary next meeting.
They've come back no hits, and they had a small hit. Of,
Oh, the other two that we're
the
doing.
trichloroethylene,
Yeah.
and I think that he's retested since then, and it's come back clean. So, but Gary, that's why I think Gary wants to meet with the board.
Right, so we'll get.
We had to increase the water because they had another resident there, so we did. So,
Okay. All right. Anything else on Flint Road landfill from you or the other board members? Okay. Next up is H-Foot Road, Berry Corner Road, and Eleanor Lane. I know we have some folks in the audience who would. Mr. Jordan.
did you get your letter?
Nope. I called in a note of complaint, garbage smell inside my garage, outside the front of my house. Took 6 minutes for them to answer the phone. So I don't know if their policy is to roll down a phone to phone to phone. You don't know on my end, but if it is that the system's not working, if they're just taking a massive amount of calls, then that's great. I don't really care. But Mrs. Whiting also waited 5 minutes on Sunday when she called. She's already received her response. I've received no response, and I called on Saturday. They wouldn't let me request an email and a mail copy. They let Mrs. Whiting get both. And the reason why I asked for both is because in the past I've gotten a mail copy, never gotten an email copy, and they always transcribe my email incorrect, so I never get the email copy. So since I requested the email copy this time, I'm probably not gonna get anything. I don't know if the board gets a copy or not, but
I got a copy.
But I think they need to be notified that we should be able to get both if we request both for this exact reason. So I'm not getting a copy now of my report Saturday. I also think 6 minutes and 5 minutes is
I know
a
that
long time.
I
to
did
wait
get
on
your
the phone.
email. It's a long time.
And really, there's a lot of people, we try to get to call when they smell it. You know, between our homes, there's many homes.
Mm-hmm.
And I'm sure a lot of people smelled it. And it's hard enough to get people to call when they do smell. If they gotta wait 5 minutes, they're probably gonna hang up. If we do hound them to call, they're gonna call.
What disturbed me was that these complaints were over the weekend, when
Yep.
everything's supposed to be covered. They're supposed to have a monitor there at the landfill that it's
Yep.
inspecting this. So my gut feeling is, what wasn't covered, because you wouldn't have an odor that strong if it was covered. And I don't know the answer to that, I can guess, but Jim, have you anything to add?
I get them as soon as they get them. I did get Mrs. Whiting's response to that she had to wait for an amount of time. We discussed it when she came in. When we get the odor response logs, we put them in a spreadsheet and we forward them to the DEP. But the DEP is also the one that get them right away. But they thank us for sending it to them. We know they're getting them, but we want to let them know that we are receiving them. These are Charlton residents, and look at, he put 5s. You had 5s in the guy that inspected.
Oh,
Is it
that's
5?
nothing. They never asked me what I thought the order was.
They didn't ask
Now
you.
she saw it.
Because what, I don't know, Nicole Croto must be on vacation or something, because she's usually the one that responds,
Yeah,
but,
somebody named
But I don't think
Erin,
she's the one that takes the
somebody.
calls though.
no, it goes to,
Yeah.
there's gotta be something wrong, and I could call Tracy and ask her, you know, what's wrong with what's with the 6-minute wait for the calls? I don't know.
Mr. Chairman.
Yes.
So, Jim, do you know, do they still have that on, in the field, third-party inspector? Or are they off for the winter, or, there was I believe we said there was, somebody from Southbridge that was, or somebody from DEP that was full-time monitoring that landfill?
Yeah, from what Andy Pelletier, the health director in Southbridge, said that the DEP has taken an active role of on-site oversight on the landfill in Southbridge, so
So I guess what I'm getting at is that ongoing, or is that seasonal? Like, we
yeah.
would be able to find out if there was something open, if that person was
I'm
around.
not sure of the status of that. I
Yeah.
could check with Andy. He may be at the class tomorrow with me. I can talk to him about it, but I'm not sure if they're technically still there. Anna Smith is part-time, and she was a landfill monitor. I think she works a couple days a week, like Monday and Friday, but she's no longer full-time there.
Mhm.
He said the DEP is, with the fine that was initiated, they hired staffing to be on site.
I'm just curious if they're actually still every day in the field doing this, or if it's
Or end of day or something.
yeah, or if it's come to a close because it's because it's winter. But
I don't know if it could have been a broken wellhead, and if the odor was strong, it was a 5. They had confirmed it was a 5. I didn't get it. Usually Tracy would send me an email that, sorry, we apologize that there was a broken wellhead. A truck backed over. We didn't realize it till after when we found it. It happens, but I didn't get anything. So usually when Mrs. Whiting complains, I do hear either from Mary Jude Pigsley or from Tracy, and they'll state that the reason why this occurred, but I didn't hear anything.
This is, just to let you know, they did mark it as 5+, and it's signed by Aaron Banford from Burton Engineering.
Yeah, he's one of the, yeah, that's what we got. The same
5+.
thing. 5+.
That's
Yeah.
the first time I've ever heard of that.
Mhm.
I've never seen a 5+.
It's, I just forwarded it to you, Jim, too.
Yeah, I did get it.
And he agreed. He left comments very strong, trash, sulfur, gas odor, stronger with gusts of wind. At the second visit, about a half an hour later, still a very strong odor with sulfur and trash. And down on Eleanor Lane had a very strong odor of sulfur and gas as well.
And Mr. Chairman, to me, if you're getting that kind of odor, there's got to be an open portion of the landfill to get that odor, because you wouldn't get that type of odor just from a wellhead. It's that pungent smell of trash has got to be from not using daily cover.
Right,
Mr. Chairman,
yes.
can we make sure somebody from this board, either Jim or one of the staff, communicate with Tracy and get Mr. Jordan's request situated one way or the other, get his email correct, and figure out if they can do one or the other or both, or what it's going to be. We just want to make sure we have a plan for that.
I'll call Andrea when I get a break. I'll be in Marlboro tomorrow all day at an update food safety class that we have to take. But I will make sure that if I try, I'll text Tracy myself if I have a break. I don't want to be rude at the classes. I'm not sure if they even allow us to have our phones on. So
I just want to get that addressed.
I'll leave
I
Andrea a
agree.
note to
Yep.
call. Tracy usually gets right back, so I'll have her email Tracy and say what was the situation. You know, I'll let them know.
Mr. Whiting.
I have a quick question. Now, I know that supposedly they're not accepting any more trash
No.
or anything, they're closing it up. I'm just curious what they are hauling in, because I've passed trash trucks
Mhm.
with covers on going into the landfill. I
I-
passed two of them the other day.
MBI trucks, right?
Both of them were different, but they were the long tractor trailers with the covers over the
Yeah.
top. The covers were mounted, so you know they were full.
Well, I don't think they're accepting municipal solid waste. They're not open for that. They've exceeded the max, but they are trying to fill and do the final cover. So whether the DEP said, yeah, you can fill this small portion in, and they allowed some of it in, I don't know. I'd be speculating. I know they have plenty of cover because it's all in Charlton. So if they need daily cover, there's a mountain of it.
Mr. Chairman.
Yes,
Mike,
ma'am.
I've seen the trucks too, Mark, and, but typically when they were hauling the trash in, it was all in walking floor bodies, all aluminum trucks when the floors push it out.
Mhm.
And the ones I've been seeing are dump trailers, like you're saying, they're all covered and everything, but that the whole truck goes up, so it, to me, it looks like it's a different product, and I don't know if it's coming or going. But I think today I've been past
I
three
know
of them on
some of them were
169.
coming because I went down the hill and they were going up the hill, going the other way, and they were lugging trying to get up there.
Mm.
And like I said, with the smell, you know, was it something that was just left up there over the weekend because they didn't have time to disperse it? I don't know what it is. Like I said, I don't know what's in it. Maybe it's cover, but it just,
One way to find out would
Could be
to-
COM 90.
when they're slowing down, hide behind a tree and then run after it and jump in to see what's in there.
you know, climb the truck and go
Yeah,
in and see
right.
what's in there.
Take some photos.
They're not allowed to leave open trash. It's
No,
just-
I know, that's.
So
that's-
I don't know if there's a broken wellhead or something, but I'll have to find out. And I will make sure I let everyone know. But they haven't.
I'm just surprised to see the trucks, that's all. I thought it was done. And
I've seen 'em.
Seeing
Yeah,
the
I saw some
actual
on
trucks
20.
that used to be going up through there, they look like the same type,
Yeah,
running up the hill, still going in there. I mean, not one after another like what we used to see, but, you know, I
It-
head out, I pass one on the hill, I get on 169, here comes another one.
Well, MBI still has all the trucks in Charlton, so they haven't just decreased any of them. So, you know, I know we can use the Oxford transfer station now, but I'm not sure. MBI has not left Charlton; it's still on Griffin Road. So.
so hopefully we'll get an answer.
Well,
to-
I'll try and
to
get an
your
answer, and
questions,
I'll
but
let the
also-
board, I'll make sure Andrea lets the board members know what we found out.
And make sure that somebody's monitoring from the DEP, some third party, that they are indeed covering, and it's verified that it's covered for the weekend.
Supposedly, according to Andy, who I've had a long conversation with, is that they don't leave on the weekend and everything has to be covered, and the DEP is assured that they don't leave until everything is covered, and right now they're not accepting, according to municipal solid waste. I know they're trying to do the final cover, but that's gonna be a long time, that's a long process, because they're still doing some shaping and grading, I think, and whether it was COM 97 material, but I don't think a truck, Matt, you can tell me better, could pick up a truck full of soil and dump it. What could it, is it that powerful to, if it was full of soil?
Yeah. Oh yeah. Mhm. And
Maybe that's what it was.
and that's the other thing too is how heavy are the trucks coming down?
You're right.
They
if
at
they're full of-
99,000 or running 130,000 pounds.
Cause the only thing it could be bringing in is for shaping and grading would be COM 97 and then daily cover, so I don't know.
Who knows? But that was a problem in a different town where they were bringing in massive amounts of dirt products and
Right.
getting paid by the ton. So now all of a sudden these trucks were coming in excessively overweight.
It would be if that was full, they're huge. Okay. I'll work on that.
Thank you.
What's next?
Oh, I wanna make sure that the folks in the audience are you good with,
I'm all good with making sure I get email and mail.
we will definitely work on that.
So you want email and mail, so I'm correct,
Yep.
right?
Yeah.
They told me I can, and I always have before, and she got it on
And
Sunday.
I always request both too, and they
I
never
will call
question it.
Mary Jude if I have to and
And they
say,
said
hey,
that
they're
stopped
telling
last Tuesday.
the Charlton residents no more email and mail, so I'm sure she'll correct it.
Okay.
Right. We'll skip over Burlingame Road water testing, we touched on that, and that will also be part of our discussion at our next meeting. So we'll move on to Valley Green Grove project proposal for 44 Old Worcester Road. I know we have a number of folks here in the audience.
Mr. Chairman, I'll be right back.
Okay.
I'm gonna get a glass of water myself.
All right. We can start, we'll open this for discussion, however you want to do it.
I'm just gonna.
Yeah, go ahead. I think I'll get some water myself. Mr. Russell, I don't know if you're the spokesman for the group, but if you want to, you can come on down, make yourself comfortable while everybody takes a quick break. Yes, it's in the corner.
I'm the guy with the top.
Yeah, it's behind everybody. Let's see. I'm thinking 3 weeks for the next meeting. We've got to get it done before Jim goes on his trip to St. Louis, which is late March. So it'll probably be 3 weeks, but just watch for it. It'll be posted or get Jim a call. Hopefully that'll work for you. Okay, thank you. You want to sit here? Yeah. Make yourself comfortable.
How are you?
Good.
How long is the meeting gonna go? I said, oh my goodness. I said, it's gonna be late. 2 weeks?
I
Okay.
think so.
Yeah, fine,
I
fine
think
with
there's
that.
enough for me sometimes sensitive things.
We can get Gary in here,
Yeah.
yeah. Which would put us for 5, that would be, 12, March 12th. That's probably okay. I'm sure it's okay with me.
Show you.
How are you?
Good, how are you? Yeah, it is March 12th.
March 12th. If we do our next meeting for 2 weeks from now, March 12th, are you okay with that?
I won't be here.
You won't be here.
I'll still be on my feeding cruise,
Okay, that's no problem.
but, you can do it without me, but
Well, Matt suggested 2 weeks. She's not gonna be here for the 12th.
Maybe the following.
The following?
Maybe the
I think
I should be
something's up
here.
with
I'm not
everything.
going anywhere.
So that's the,
19th?
19th,
Yep,
looks good.
okay. We'll discuss this with Jim when he gets back at the tail end of the meeting, but that's good. Music.
Yes. New computer, hopefully it can make it work.
We used to have something that plug up right under the wall, like a screen, and it would, so like everybody could see it.
Okay.
I don't know if Jim did anything with that, but
It's gone.
we've had some presentations up where it was, so everybody could see it.
That's right, this one will be in stereo. If you get that one. How's everything?
Good.
Kathleen's keeping us on
Oh, that's
And rough back and rough.
she's a pro, she's been doing this for a long time.
All right, we're about ready to get started again. Jim?
Sorry, Jordan, stop me.
No, that's fine. Are these the latest plans that we have for VGG? Is that it? Just a qualified?
Yes.
Okay. All right, I'm gonna open this up for discussion. I think we have 2 folks here that are assuming you're both butters, or I know you are butters, Jerry.
I'm at a butter, Ed is over at Carroll Hill.
I'm over
Okay.
here, yes.
And I've heard you speak at some of the meetings. And so, okay. By all means, go ahead and
Well,
we'll.
Mr. Chairman,
floor is
thank you
yours.
for allowing us in,
Mhm.
board members, appreciate it. I'll be brief. Ed has a presentation, but I just wanted to talk about the broad powers of the Board of Health with regard to definitive subdivision plans. And the law allows the Board of Health broad discretion to review many things, health, obviously, safety, and drainage. And I just want to touch on a few quick points. The road, Old Worcester Road, is 22 feet wide. I have a poster over here that I can show you. Photos that, well, I took out walk the road every morning, and here's a school bus coming by. This is the entrance to Charlton Orchard.
Yep.
And this is up by the Miller Funeral Home. This is a dump truck. And as you can see, this is one of our first snowfalls, I believe. And the bus certainly could be over a little bit more. But even if it were over a little bit more, a tractor trailer truck or a dump truck would have difficulty getting by it. We see this all the time. We've lived on the road for 30 years. And the number of trucks, dump trucks, construction trucks, delivery trucks after the VGG project is built are hundreds. You can see the numbers here, hundreds of trucks every day, and that presents a safety issue for the people who not only travel the road, but little children who are going to the 3 schools nearby. So as I said, the road, Old Worcester Road, is 22 feet wide, and this is something the planning board will deal with, obviously. The required width for a commercial development, and this is described by the proponent as non-residential, that would thereby make it industrial or commercial. The requirement for the road is 35 feet, which is far wider than the existing 22 feet. So that's a safety issue.
And that's not just into their facility, you're talking anything that leads to that facility.
Well,
where
I'm
they're
talking about the paved area from one side to the other,
Right.
not the right-of-way.
Right.
I'm talking about the paved area.
Mhm.
And the paved area, according to the town's rules and regulations for subdivisions, the paved area must be a minimum of 35 feet. The existing roadway now, paved, is 22 feet.
Okay.
So that's a problem. I don't know if VGG measured the road, but it's 22 feet. And it's 22 feet from Route 20 up to Main Street. So it doesn't comply, and for safety reasons, that's a significant problem. And then there are drainage issues, which just compounds the traffic and the safety issue because of poor drainage. That's an issue that Ed will address. One of the things I'd like to talk about is the drainage regarding the swale that exists on Old Worcester Road, then drains into a pipe that comes to my neighbor's property, 59 Old Worcester Road, and that's a 12-inch concrete pipe. That goes down my neighbor's and my property line with my neighbor, and then that pipe underground goes onto my property and empties out onto the back of my property. And there is no town easement for that pipe. So any drainage coming from this project, if it is built, whatever's coming down is gonna end up on my property. And my concern is that I can't see how the town can legally permit a project that is dumping water onto my property. So those are my issues, and Ed can speak to these things much better than I can because he's an engineer.
Yes.
So, good evening, I'm Ed Carson, I live at 47 Hanson Road, and I wanted to make a couple of points regarding the proposed subdivision that I feel are, strongly feel are real safety hazards. The biggest one being, and I'll show you on the plan, they have recently revised the plan. I don't believe they've addressed this issue. It just came out the other day, and I haven't had a chance to get it. I believe the engineers that are here from BGG, and they can correct me if I'm wrong, but basically, I'll just give you a quick overview of what's going on, or what the plan is. So basically, the developer is planning to cut a road, into the mountainside here. There's a very steep grades that come off of Old Worcester Road, and built a small cul-de-sac. And then the idea is because the town bylaws require, or subdivision regs and bylaws require a 3-to-1 slope. No, you can't build anything greater than 3. So basically, they've done a 3-to-1 slope as far back as they can go until they hit the regular grades up and around here. And so this is roughly 9 acres plus that they're gonna be disturbing. So there's a number of issues here as far as drainage and safety is concerned, from my point of view. Number one, the current plan is to take all of this water, run it. There's a French drain, or more like perimeter drain. French drain is the term for it, but it's an underground drain system that goes the whole length of this underground detention system and around the road. Discharges into the 2 catch basins, goes to a manhole, goes to another manhole, goes into this underground, what they're calling a detention system, and then it comes out to a pumping chamber, and then gets pumped up to a discharge point, where it then dumps into this is like a small leveling pool, or what they call a plunge pool. And then what's gonna happen is it's gonna cascade out of that and go down, here's the right of way. The road is about, this is a 40 scale map, so it's about 3/4 of an inch, so you're talking a little over 20 feet between, where they're dumping their stormwater and the actual paved road. Now, I'm sure all of you have been down this road, and basically, this is a classic country road with where the road is crowned slightly so that the drainage, when it rains or snows or whatever, it just comes off the road and it goes into like a little bit of a swale or depression in the side of the road. In this particular case, there is a manhole. Maybe it's in the other sheet. Actually, I have a highlighted sheet. So there's an existing catch basin here, and this is the one Mr. Russell was talking about. It's a drainage inlet, and it actually goes underneath the road, goes to a drain manhole, and then goes a 12-inch pipe out through the back of the Russell's home and into a wetland. It actually forms a stream that goes down further, basically ends up in Mr. Moore's property, where he has a fish pond, so it actually goes to a fish pond. There's another catch basin along the road over here, drainage inlet. And this catches all the swale water that comes off the road, or anything that might come off the property in this area, goes into this and then kind of meanders its way. It's almost flat. Meanders its way into this basin, or drainage inlet, and then it gets underground. There's a pipe from this basin to this basin, and then out. If you go out here during super cold weather, you'll notice that this is actually not frozen along here. There's actually a natural spring here, so it's always wet, even when it was 10 below a couple of weeks back, where we had numerous days in a row where it was below freezing. This was still running and actually feeding that stream down below. So when you're looking at this plan, there's a couple of real problems. One, they're going to put a road right on top of a natural spring, which is a problem because obviously the natural spring is Mother Nature's going to win here. You're going to want to come up and end up either going over here, or put out in the road and break out. You'll end up having an icing condition for that part of it. Number two, when this water comes through the system, it gets pumped out of this pump, and according to the documents that I've seen, it's going to be pumping at 400 gallons per minute, which means it's going to come into this plunge pool, which is supposed to slow it down, but it's still 400 gallons a minute, and then it's going to come over the top of that through a riprap swale to slow it down and prevent erosion. But there's nothing preventing the erosion in the public right of way. So from here to the road, where they have this basically dirt, leafy swale, there's nothing going to be stopping this water.
And it's about 20 feet.
It's about 20 feet. So you're going to get erosion there, obviously. You're also going to get
Excuse me.
the swale that's
You
here.
can't cover up we can't record the meeting with the paper.
I'm sorry.
Oh,
Sorry.
Sorry, I missed half that.
Good call. So I guess so this is a big concern, because you're gonna have all this water roaring out here and causing erosion control problem, as well as a drainage problem along the edge of the road. The way this drainage system is set up with the French drain along here, it's gonna be picking up the groundwater. So instead of, you getting the natural drainage flow over here, you're gonna get this thing pumping all the time, because basically you're gonna be dewatering this whole mountainside. So if this is running full time, obviously you're gonna get a lot more water coming out of here. And there's nothing protecting this area, because it's in the public right of way. And certainly the swale is not there or designed for this kind of operation.
What's in this area here?
This is pavement.
So
That's
all
the road,
pavement.
all paving. So that's another issue I'll bring up in a second.
Okay.
But what I wanted to show you was, this is, I'm an engineer on a project currently in Worcester. We're building a brand new pump station on Willow Drive, and we're down 30 feet and dewatering the hole as part of the construction. And this is what the dewatering looks like. That's all coming out of our job site. It's almost like a brick, as you can see. It's a 12-inch pipe coming from the site. It breaks into two to dissipate it, goes into some riprap, but that's where the flow is coming out of it.
And do you have an estimate for the gallons?
So the
per-
gallons on this are anywhere between 800 and 1,000 gallons.
Okay.
So what I'm pointing out here is that, that's an awful lot of water, and at 400 gallons a minute, even if it is 400, because that's their calculations, it could be more if that doesn't work, and I'll explain that in a second. This is what's gonna be coming down over the edge of the road here, and obviously that's, be a safety hazard. You have to understand that we have a 60 by 60 hole for this project. This project is the size of a football field. It's 250 by 180. I think it's 150.
That's the detention area.
That's a detention area.
Can I just ask a point of clarification,
Sure.
Mr. Chair?
Mhm.
To Ed? So, this plan is dated October 11th, 22nd, where is it? 22nd, yeah. And according to Todd Gerard, he's working with Graves Engineering, and they're reviewing updated plans.
Okay, so these plans have been reviewed a number of times,
Right.
and there's, I don't know what has changed, the newest set of plans have just showed up the other day.
Right.
With that said, the basics are still here, it's the same location, same layout. The engineers are here, maybe they can explain what has changed on the plans. I know every time they've come to the meeting, we've had a number of things that weren't on the plans, that the planning board has not been happy with and has sent them back to the drawing board to fix.
Right.
For example, there was a time where this overflow was actually going about a couple of thousand feet away and dumping right into the brook. And they removed that because it was just kind of silly.
So I
they've
guess I'm
added
just
it here.
wondering why we're dealing with this if Graves is already dealing with it.
So I think that the reason for coming to the Board of Health
Mhm.
is because, according to case law, believe it or not, you guys are the authority on safety. And according to,
And drainage.
and drainage. So, look, again, this is the
This is
Massachusetts.
what you sent us
Yes,
earlier, yeah.
yes, correct. So, I guess our train of thought is that, it's very important for any of these projects to go through a number of boards so that everybody's on the same page. We found that out last night because we went to the Water Sewer Commission, asking about the abatement and the water and sewer here. And, they have not received any plans or anything on this project, and are in fact gonna come to the next planning board meeting to express their concerns with the board.
So they've reviewed these plans?
They haven't, water
They
and
have
sewer have not.
Okay.
They haven't received anything. Either has Concom, because I reached out to Conservation about the fact that there's a stream, and even Mike Andre from Graves addressed it as a stream behind the Russell's home. And right now, the way the plans stand, I don't believe they trigger a conservation review, or a filing, an NOI or an RDA. But if it indeed is a stream behind the Russell's house, it could very well trigger an NOI, because I think it's a perennial stream. And if it is, then if you're within 200 feet, you trigger the Riverfront Act, and that means you would have to file with them, and they would have an opportunity to review the plans. Looking at the case law and looking and trying to understand this better, it turns out that actually the Board of Health has, a lot of rights here to ask about the drainage, and most importantly, which is what right in your dailies, is making sure that everything is safe. Just like you guys talked about vaping, and all these other things, safety. And it's very clear that this design here is not safe. And that's just one of the reasons that I pointed out. There are several others.
One of the questions that I have, because I'm not too familiar with exactly how these plans, for a project this large, how it kind of walks its way through the process. Is the feeling of the board, and Kathleen and Matt, maybe you've got a little bit more experience with this than I do, but is this something where the planning board would say, or any other board would say, well, we've already reviewed and made whatever, 6 or 8 or 10 revisions to this, there's no need to have the Board of Health involved at this point, Jim?
I think anytime there's a plan, it's forwarded to me, and I think even Todd, I met with Todd today, is in the planning stage, since there's be a sense of duplicity, I have a right to make an opinion. But they hire the engineering firm, which yields to, you can't have it where the planning board hires an engineering firm, and then the Board of Health hires an engineering firm, because I'm not a wetlands expert. So I went and sat down with Todd, and I sat down with Bill. And Todd and I reviewed it again this morning. Mr. Russell, your concerns with the board and authority. Yes, the board has broad authority, but in this case, it's not. It came as a plan, and it's still being reviewed by Graves Engineering. So to make a, they met on the 19th. Mike, Todd, and Bill reviewed Ed's punch list, and items of revisions will be made. So Todd, we went through every single line, and Todd made notes on the comments, and even Todd has yielded to the planning board, because then Todd would have to hire a wetland engineering expert. So in the town's process, yes, it goes through planning. If it doesn't pass planning like before, planning board VGG for the marijuana, it was done. It didn't pass through planning. It didn't need to come for us. We sent our letter stating that it would be 0 emissions, and now I get plans like this all the time for all kinds of cul-de-sacs and complexes. But it's reviewed by Graves Engineering, who the town hires. I'm not a wetlands engineer expert, so to arbitrarily say the board has the authority to deny it based on, I don't know, we're all smart and educated people, but I think that's why the town does its due diligence, sits down with Todd, who is the wetlands expert, when you talk about rivers and lakes and stuff. And I sat with Todd, and Todd's still reviewing this. So I think it's in a stage of where they've met, they've asked for revisions, and they're going to come back with them. So that's why I met with Todd today to say, hey, what's going on? And we read the letter, and this is Todd's writing. So Todd did make some comments on them, Swales, and he said, yeah, there's still lots of work to be done.
Mr. Chairman?
Yes, Mr. Russell.
Just for a point of clarity here, I did have a phone conversation with Mr. Gerard. I personally requested that he come to my home and inspect the wetlands on my property and across the street. And I asked him as well, at what point would the Conservation Commission review the plan? I was not given a receptive reaction. So that was a problem. I don't know if he has as yet studied the plan. I do know that in the rules and regulations for a definitive subdivision plan in the town of Charlton, it calls for, and in the state law as well, calls for a mandatory review by the health board. And I don't know when these plans came into the Board of Health, but it calls for a review by the Board of Health, not by the health director, but by the Board of Health. So, it would be.
That's not. I can't send every single plan. I get 15 of these a week. To send them all to the board, I let the town hire Graves Engineering to do their due diligence and report back to us. They're hired by the town to do its best due diligence, and I review the plans. If they need septic, they're the well placement, they are there, and then I rely on the planning board and the conservation board to, through Graves Engineering, as Todd does, and the planning board, to say, hey, is this acceptable? Does it meet the current laws and regulations? And I review them, yes, but I'm not a wetlands expert or an engineer, and neither anyone on this board. So to arbitrarily say, and I do understand what you're saying, that we have broad authority, but let's let them do their work first. We haven't even got the paperwork back.
So Kristen wanted to,
so
she has her
if I may
hand up
answer.
there for quite a
We're-
while,
excuse me.
in the back.
Oh, sorry.
She had her hand
Yes.
So I
up
just
for
have
quite a
time for
while.
1 second, please. So section 81U of the state code says that the Board of Health has mandatory review of all subdivision plans, and that they do have the right to deny those plans if they find a case where they don't meet adequate stormwater, septic, or water services. It is in their purview to
Yeah,
do that by
certainly.
state law. But I'm not done. And also our local bylaws also state mandatory review by the Concom and the Board of Health. I myself has also emailed the Concom and copied Mr. Gerard. 3 weeks ago, I've gotten only a response from Rose, the secretary. Nobody else has responded. Nobody else has spoken back at all, not even to just say, yes, we acknowledge we received this message.
You
Only
called me,
Rose.
you said?
No, no,
Oh,
Concom.
oh.
So I'm just specifying to you that we are here because we know that it is within the authority of this board to make this action, and that they are willing to do whatever they feel is right. They're elected by the people to have that authority. So you can't say that it's Graves, because we've been to 8
Yep.
hearings with Graves, and we have found numerous things that Graves did not
I
find.
think it's not just Graves, if I may, Mr. Chairman, I think that if the board would make a decision based on data, okay? Someone who is qualified to do an assessment of something that's going on, to inform the board. Now, when I get these plans, they're plans that are still under review. So I did meet with Bill Scanlon and say, where are we at with this? All right, there's also a letter from Meridian Associates, and I spoke with Todd today. He said they're far from accepting anything, and they're still under review. So once they come back with a final narrative, then we would take a look at it, whether they're compliant or non-compliant, and that's the planning board's decision at that point to say, yes, and I always send a letter that I've looked at the plans and waiting for pending plans, and it's not my fault that they hire Graves and they're not trusted, but that's who the town hires.
I'm not saying they're not trusted, I'm just saying that there's been a lot that they've
But
missed.
I understand, and I understand
This is a
the
massive
process.
project.
But
I'm
I
not
don't take
taking on
anything
that.
lightly, and I know that there's an issue, but when I get these plans, I sit down and look at them. If I think there's an issue, I go and see Todd, I'll go and see Bill, I'll see the planning board. I talked to Peter Boria today, he said you did attend his meeting last night, and we do a due diligence. If I felt that there was anything that Graves would bring up, or Todd Gerard felt that there was something that was incorrect, and it would be, and he works for he's the conservation agent, and he handles stormwater management for the town. You're required to do that. Then I would have Todd come before the board and speak to the board of his concerns. So that's why I met with him today to address Mr. Russell's letter, and he did say that he's still reviewing with Graves, and there's a punch list that Mr. Kochland did give him, and they're making revisions and he's waiting for them. So I'll meet with him again. So it's still in the process of a review, is what I'm saying.
We've been told that the most final set of plans came in last Thursday. Graves' letter is currently
I have
on
not
the
seen them.
internet. So I believe that part is completely concluded.
I think the
And
last,
the-
January 17th is,
Can we have everybody
no,
go
more
to
than
the chair,
that.
please?
So,
I'm
the
getting
the
confused.
planning board intends to make a determination on the 6th of March. So
Very
there's
soon,
a
very soon.
tremendous amount of time.
All right, one at a time here.
Mr. Chairman, just one question.
Yes,
Have any of the board members seen any of these plans?
we have gotten some preliminary plans, and as Jim stated, these were
I
from.
haven't seen them,
You haven't put your eyes on them?
no.
No, and the reason is because we know that they're going through all sorts of changes. I think, Jim, at a previous meeting, you stated you actually had plans like this, and you said, I've
Yep.
got plans, but they are incomplete, I think is how you put it.
there wasn't much on them in the narrative, and I read, and I get plans, a lot of plans for all the systems. And that's when it's to my doom. I'm the director. I don't think I'm going to be sending all the plans for board members to review. I allow the professionals to give an opinion to the board, and if I felt there was an issue, which I tell the board, I always keep you updated on these issues, that if there was an issue that Graves said they didn't comply with A, B, or C, or Todd Gerard, the conservation agent, said there's a vernal pool and is running into Mr. Russell's yard and it can't be done. I know the water line's going through there, the road will be upgraded. There will be new storm drains, but that's, and I know they're saying it's under the purview of Section 81, Section A. Yes, if we felt that any way that they didn't comply with the well, with stormwater, but we're not stormwater management here. Todd Gerard is the stormwater management for the town of Charlton. He advises the board and myself if there's an issue with stormwater management. That's a big thing with the state now. Okay, he said that, but Todd is a stormwater management
Todd
person.
doesn't have their vote. They have the vote. They're given by the people. They're elected
Well,
by the
then if,
people.
what I'm saying, if the
Todd
board,
can say whatever he wants, but the board makes the
but I
decision.
think the board has to make an informed decision, is what I'm saying.
Absolutely. And by the way, the Valley Green Road representatives are right here, so they can tell you if you have the most complete plans or not. Is that the most complete plan?
I think you have to go through the chair, ma'am.
Oh, I'm sorry.
All right.
Sorry, I didn't mean to.
Mr. Koch.
Let me speak, thank you. Okay, so I understand where Mr. Philbrook is coming from, but I'd like to just point a few things out. Number one, at the last planning board meeting, the board unanimously agreed to make sure that the Board of Health and the Concom review these plans thoroughly. So they made that request already. And that was in light of the fact that it's right here, 3.3.7 of their regs that say that, you know, it's mandatory for you guys to review these plans. So, you know,
That's not true. Mr. Chairman, I need to intervene. As the director, it's my job to report to the board if I see there's anything wrong. I'm not giving you plans. You want all the plans? I have plans stacked to the board. I think if I come across a section where I believe there's an issue, I bring it up to the board. But it's not under the purview of the board, and I, as the director, to every time I have a set of plans to bring them to your house. I don't do that, and it's never happened here. I think we've had hundreds of projects that involved stormwater management, and now this one seems to be where I have to bring it before the board. I review these with the competent people that the town has hired, including myself, to make a decision that it either complies or it doesn't.
I think
Point
we're,
of clarification.
So-
I need
I am
to
the-
say something, this is a point of order,
okay. All
okay?
right.
I think each person speaking here, should speak until they're finished, unless they take for half an hour. And then you call in the next person, because
Okay.
otherwise I'm getting too confused here.
Okay. Well taken. So let's try to abide by that going forward. Mr. Kochling, if you want to continue.
Yes, thank you very much. So, I guess my point being, that at the last meeting, the board actually requested you guys to review this plan. Okay, they also requested the conservation department to review the plan. I took, you know, this is all on my own time. You know, I spent the time to, you know, craft an email and sent that to the conservation, you know, group. I actually went to see the chairman, and he recommended I went to Mr. Gerard, which I did. I sent a nice email explaining, you know, what it said here and what I've noticed out here, and I also provided them Graves' report that highlighted the stream and the wetlands and things, you know, behind the Russell's home, that this subdivision would be impacting or has the potential to impact. With that said, this is not about wetlands at the moment. I mean, there's wetlands downstream. Obviously, it's about 200 feet away. So anything that comes off this project will clearly impact those, because it's a direct line through this existing pipe. As far as the drainage is concerned on this property, or in the road here, it's unfortunate, but the town drainage, which in this particular area consists of 2 drainage inlets that connect to each other, go through location and discharge onto private property. There are no easements or no, the town has no legal rights to discharge that water there. I think it's fair to say that right now there's no issue with that, because it seems that a big part of this actually is the natural spring that's coming out of the embankment that's actually feeding the wetland and the stream. And obviously, we're all about protecting our natural resources, so there's no issue with that. The issue really is if you're gonna have a plan here that's gonna not only, impact that area with the drainage system that they've, designed and proposed, that's one aspect. The other aspect is just the safety of it. So obviously, this is gonna erode the side, and it's gonna cause an erosion control problem, which is gonna impact those wetlands. That's kind of a no-brainer.
The other part of the problem here is that, so in the winter, for example, when you look at the pictures, this whole swale, like all the swales in this area, are full of snow. So you have to understand that this underground detention system is 12 or feet plus below grade. It's underwater actually, which is kind of crazy, but it's underwater. So even in the winter, that water's not going to be frozen. And when we get these weather patterns where you have rain some days, snow other days, this is going to fill up and it's going to be discharging out into the snow on the side of the road.
Yep.
And so that is going to, obviously cause icing, huge safety problem. And it is the purview as far as we have understood the law, because we've done our homework. We've gone to the land, Massachusetts land use permit, and it specifically spells out how the health department engages in health and safety on subdivisions specifically for drainage. There's two parts of drainage, where does it go and volumes, and then the other part is it gonna cause a safety problem
Or a health
and
issue.
a health issue. So there's two things here. The safety hazard is very clear. I mean, I'm sure you guys can see what I'm talking about. I showed you the video of what it looks like when you're pumping water in that kind of volume. The other part, which I discovered, is the underground detention system. So these are really systems that you see in much smaller scale, but also in areas of high volume or high concentrations of people, like Boston, bigger towns where land is extremely expensive, and the area that they have to, provide the stormwater controls and everything are, not physically there. They can't build a pond. Here you could build a pond. For some reason, they're choosing to go underground. So when you get into underground systems, it turns out that, on a piece of paper they work well as far as capturing water, although this has the same invert, so I don't understand, it's not really capturing any water, it's really just slowing the water down. Let's see here. It turns out there has been very limited studies done on actually the health problems that arise from these systems.
Would that be because of the length of time that the water's there and?
No, it's basically the biological process is what it's called about, and I've made a copy of this to submit to you guys. Okay, and I put the website at the top so you can see the whole report. I just copied the conclusion and highlighted the part that they said, well, look, we didn't really talk about this aspect of underground detention systems, but there's big concerns on the biological, and to me, that's another huge safety problem, because
And E. coli just
Right.
stuck out as part of it. If it's related to this specifically,
Right.
that would be a concern.
So typically, the only information I could find, I found some from North Carolina, as well as Burlington has some regulations for stormwater pumping systems, but this is really about homeowners dumping stormwater out of their basement and dumping it out into the street, because we all know what happens. It goes out and causes an icing condition. When you think about it, that's somebody's basement and it's a pump doing 60 gallons a minute, a little sump pump. This is a 12-inch pipe coming out of a football field size detention system collecting 9 acres of water. So it's very clear that the water coming off it here is really gonna cause a huge problem over here.
If I could interrupt, have you been to the highway department about this, about the road and the drainage and?
I think I'm looking at it right here. I've got it.
That's
Is this
next.
your copy?
No, it's your copy, I made it for you. Actually, what we've discovered is that the developer has not gone to any of the other boards. Okay, they haven't gone to water and sewer, they haven't gone to, I don't believe they've gone to the highway department, because anybody in construction can look at this and see that this isn't gonna work out. Okay, and I don't see the town approving a plan with that component, as well as, the dangers of this, the biological effects of this component. There's also other flooding issues on this project. Okay, if you look at how the slope is constructed, you have to understand they're planning on building a slope that has a 90-foot vertical drop, and at 3 to 1, that means it's 270 feet long. their proposed plan is to go along the grade lines. These are compost ducts, so they would be removed. But these other lines are just riprap swales, not swales, actually riprap sort of dampers, so that as the stormwater comes down, it hits these, and it's supposed to slow the water down. But
For infiltration?
no infiltration. That's another part of the problem with this. Is this plan does not meet stormwater standards because it is not providing any groundwater recharge.
Okay.
And I believe their French drain that goes the whole length of this and goes into this system is going to do the opposite of recharge. It's going to decharge. It's going to be picking up all that groundwater. And I can understand why. I mean, this is a huge hill, and there's going to be a lot of groundwater. They have not provided any borings at this area where this work is being done, so you don't know where the groundwater is. Mike Andre's report indicated that you can see the surface water breaking out here, which is the natural stream. So obviously that's where groundwater is. So if you're going to be down 12 feet below that, you're going to be in the groundwater. Okay. So I guess what I'm saying is that this design where they have these are just supposed to slow the water coming down, and actually I don't think that will happen. I think what will happen is it'll hit this riprap, and actually, like anything else, it'll follow the riprap until it point loads and come over, and eventually you're just going to have this point loaded washout for 290 feet. Engineering standards require for this kind of slope, they really require surface drainage. In other words, for every 100 feet coming down the slope, you should have a surface swale that catches the water and diverts it off the property.
And there's none of that indicated.
There's none of that in this. So that's going to cause a safety hazard, I believe, of washouts and problems coming down in here. Whatever gets down in here is going to go down in here. And I guess the last point that I would make is, I mean, I realize that the engineering and the calculations that were provided state that there will be less water coming off this site. But you really got to ask yourself, a couple of basic questions. For example, right now, the only way the water gets off this whole area and the road is through the little drainage inlet
12-inch pipe.
that goes off here. And you're talking about 2 catch basins that have 24-inch pipes, because that's what was required. They have the 8-inch pipe that's over 500 feet long going into those. Goes to a 24-inch pipe, which goes into this system, comes out at a 30-inch pipe, and then gets pumped by an industrial pump up a 12-inch pipe and dumped over the side. So those are issues. I think the other issues, for example, for safety is that they came up with this new design for an overflow, which is a pool. I don't think we want to have a pool that's not fenced in, for example, because obviously you're going to have standing water here. It's not a good thing. And the other question I would have is that if you have standing water in these areas, is that not kind of a problem for mosquitoes? And that's
And this pool here looks to be about 40 by 60 feet.
Yeah. And you have to understand that this probably won't be activated too much. I mean, this, part of this design is that you're going to have this dual pump system and everything, and they have brought in, per some of the questioning in the previous meetings, the question was, well, hey, if you have a pump, what happens if the power goes out? No. So they've added a generator, which now you have a generator and fuel over here in the middle of the area. So there's a lot of concerns with that. So one of the things, other than this project, I'd like to point out to you guys is that you should really be looking at what goes on with stormwater pumping systems, because I think they're very dangerous, and the town should be looking at putting together some sort of rules and regulations regarding that, because it really isn't, from a highway from the town standpoint, we don't want to have to maintain this. And I realize that in this particular case, the developer is pitching the idea that it's going to be the lot association that's going to deal with this. But the harsh reality is that those type of setups never work. I know in the city of Worcester that we've had to take over every pond or water treatment device simply because the property goes, they just don't pay the taxes on it. It goes to tax title and we own it anyway. And neighborhood associations, nobody chips in. After 10 years, it's in their deed. But how do you go to somebody, knock on their door, and say, "Hey, we have to maintain this. You have to pay X amount of dollars." It doesn't. It's just not realistic. As much as the developers want to tell you that, it's silly.
Can I just get back to the revisions? I just want to see something here first for a second. these revisions are coming rapid fire. This isn't just one simple question that made the revision plans. We have revisions from December 11th, December 20th, December 28th, January 2nd, January 9th, January 14th, January 17th.
What's the latest one?
And is
Just
this the
other day.
latest?
No, the latest one was, Thursday, I guess.
So these are every week or more often. And that's part of the problem. I think that,
So, Mr. Chairman,
Yes.
if I could, I guess, I'd be more interested in looking at these plans when they're finished.
well, finished or closer to finished, and I'd also, I hate to say it, I'd like to talk to Mike Andre. He's the head engineer that's looking at this as far as the town.
Yeah, I believe it's Mike Andre.
Okay.
Yes, it is.
Because I'd kind of like his take on some of your concerns and other concerns that you haven't brought up yet. I don't know if you're going to, questions that I have. So, yeah, Kathleen, I'm kind of with you on this. Of course, the last thing the developer or anybody else would want would be to have something and the planning board and Mike Andre, it's all set, and then they go to another board and that board says, wait, you're out of compliance with our rules, you gotta go back and you gotta change one thing, but that affects 6 others.
Well, like Jim's always pointing out, we can't turn it down out of hand. We'd have to have reasonable costs.
Correct, yes, Jim?
Mr. Chairman, I get these plans all the time
Mm-hmm.
for projects, and I do my due diligence to make sure, and so does the town, and so does Todd, to make sure that the input from this office, which is my job as the health director, as your appointed authority, and if I felt there was a denial or a reason, then I would bring them forward. But I have not ever given the board members the plans for review for major projects unless they came forward for a variance or waiver or whatever, because the town has a process and they hire someone in the beginning of the process, so it's not us hiring someone to review the plans as an engineer to do we're one of the few towns with a full-time conservation agent who handles issues, and he's very good, and the town and the planning board is very diligent in their process. But when I met with Todd today, and I've met with them in the past and continue to meet with the town planner, Bill, is that this is revisions are being made all the time. So to make an arbitrary decision that for this board to say we're not happy with it because of health, life safety or environmental issues, we'd have to back it up with someone who has an engineering degree who would be, the town is hired to do the due diligence to let the board know that we don't think this project should go forward, and I don't think it'd make it past the planning board. And on the 19th, I was not in on the 19th, otherwise I probably would have went to this meeting. And they had a meeting to discuss it, and Todd, I believe, did say he did go out. But like I said, I don't speak for Todd, but I think we need to let them do their job and find out, and let them make the revisions if they can. I think it would be denied at the planning board, and I would send a letter from this board with the board stating that we would expect all plans to be final and approved, and then take a look at them.
Mr. Chairman?
Yes, Mr.
Just to
Russell.
answer Mr. Philbrook's statement regarding Mr. Gerard. He gave me no indication that he was going to visit my property and look at anything. In fact, Mr. Gerard was outright hostile to my request. Unfortunately, I'm sad to say that in a public meeting, Mr. Gerard was hostile to me. So I had even scheduled a appointment with him to discuss the project. At first, he was suggesting that he didn't even know what I was talking about. And Mr. Chairman, I would say that, given all of these plans and these many months, and maybe now up to 8 revisions, it's fair to say this is the biggest project ever proposed in the town of Charlton, probably in Central Mass, at 1 million+ square feet. I would think that your eyes would have been on these plans at some point during this 8-month-long process. And I must say as well, I talked to Tom O'Malley, chairman of the Conservation Commission, great guy, pro-business, and I asked him if he has had a review, have these plans been before the Conservation Commission? He hasn't seen them.
Right.
So if I may, Mr. Chairman, I did reach out to Todd Gerard as well regarding this, and he flat out told me that he was not gonna review these plans until they were submitted to Conservation. And as I pointed out, the way they're set up at the moment, they do not trigger a Conservation review. The only thing that's requiring them to go to Conservation are the planning board regs that say, hey, you need a mandatory review, and the board wants to hear from you. So I guess what we're looking for from you is a letter to the board that would say, we've looked at the latest version that you have, which is this version, because you haven't received the new version, and, you know, there are safety issues on it, because I think I pointed those out.
Did I hear you right? You said that this could possibly totally bypass Conservation Commission?
Yes.
They would not have any say, they would not be able to review?
That is correct, because originally,
It just sounds wrong.
a few sets of plans ago, this was triggering Concom review because they were doing work within the 100-foot buffer zones. And that's, to be honest with you, was a little disturbing here was that when I asked Mr. Gerard to go out and look at this, because to me it's clearly a perennial stream. It was also identified as by Mr. Andre as a stream. He said, nope, I'm not gonna go out there and do any of this work until I officially get an NOI or an RDA submittal from the developer, and it's kind of a catch-22. My point was, you're not gonna get that because it's not within 100 feet. What's gonna trigger a review here actually is if it is a perennial stream and they're within 200 feet, and then it would have to come. With that said, I didn't realize it, but I did find it in the regs that they are required to do a stormwater report for this under planning board as well as Concom, and they do not meet that. And there was a lot of pushback at the last planning board meeting regarding meeting stormwater standards, which should be very alarming to everybody in the room who's from Charlton, because right now we're under, you know, the MS4 permit for stormwater, which is pretty rigid, heavy fines, and we should not be approving any plans at all in this town that do not meet the federal and state, you know, stormwater standards. That's crystal clear, and so I don't understand why the games were being played there. It doesn't matter. Right now, what we're before you with, or what I'm came down here to point out, was there's some serious safety, stormwater, drainage issues with this proposed plan. If you want to get the latest version and see if any of those things have changed, that would make sense, but I don't believe so. They have no place to go with their stormwater other than out into the street, which now goes onto private property. And I don't think that the town or a single board in this town should be permitting any projects that discharge stormwater on private property, okay?
And what did planning board say about this? Have you been able to go?
I haven't gone this route yet, pointing out these safety concerns with the erosion here. I mean, after all, they do have an engineer, Mr. Andre, he's a very competent engineer. However, for whatever reason, he has not highlighted a lot of the features that I have highlighted. My background is that I review plans for the city of Worcester, and I work with the Concom as a Concom agent. I have knowledge. I've been a field engineer for 20 years, and you know, one of the things that you learn as a field engineer is that not all the time plans don't always work. There's a common sense component to plans, and you have to sort of, you know, connect the dots. And
That's for sure.
and I'm connecting the dots here and pointing that out.
Excuse me a second, Jim.
As part of the plan review that
Okay.
was sent to me, the narrative, the stormwater management review,
All right, and this is, the last revision on this was January 17th?
that's the last thing I received, and this is really not a plan like, that would be like that, it's more of a site plot plan.
So, Mr. Chairman, if I may.
Yes.
There's one other thing that I'd like to bring to your attention that's very clear here that's come out of this whole, and it's a good thing, which is that what I'm noticing, and I think what some of the other residents are noticing, is that, you know, what the developer is doing is just, you know, sort of going to one entity at a time without really going to all at the same time, or doing things in a reasonable, rational order. For example, we went to Worcester, to the Water Sewer Commission last night, and pointed out that, well, look, you know, these guys are looking for sewer connections, they're looking for 2-inch water mains, there's a 6-inch water main connection, and the board was like, what are you talking about? We haven't been submitted these plans, how do they know that we have capacity to give them this? That brings up another big question. What exactly are they building here? They came in and told the planning board that it was a non-residential subdivision, which I'm not sure what that means, but according to the Water Sewer Commission, they were like, well, 2-inch water service means it's commercial, and that designates this project as commercial, which means they have to go to them, so they know what their discharge is gonna be, what their needs are, because they might not be able to meet them. This water main is going in, I don't think they have calculated a 6-inch water line to come off for a fire sprinkler for a huge building. With that said, that would be another question I would ask of the board here, would be to ask the developer, what are they building? The only reason for putting an underground system here, in my mind, is to build a parking lot. Are they building is this an area, for example, that they plan on processing marijuana plants? Is that what's going on here? And if that's the case, that would be a big health department issue. I guess my point is if you don't know, we need to ask. Another thing on these plans that's very strange, and these guys, the developers, engineers are here, and they're gentlemen, and I do want to ask them. I don't understand why you would have this 5-foot strip between the property and the frontage on the road, for example. That can't really be maintained. So is that an issue as far as the health department for safety? Is that for tax reasons? So now you don't have frontage on this road and don't have to pay taxes to the town, or is it for the betterment? Now that you're not on that road, you don't have frontage on the betterment. Do you not have to pay the betterment? So I don't really know, but as a resident taxpayer, those are kind of questions that come to mind. These are unusual things to see. Okay, they used to use these in big developments called spike strips, because what they would do is they'd be forced to give open space as part of their project, and then they would put this little spike strip in so that nobody could develop it.
Mhm.
So I don't know what's going on there. So those are questions I would ask the board. If you could get answers to that would be great.
So, Mr. Chairman,
Kathleen?
I served on the Board of Health in Burlington, Massachusetts for 9 years.
Oh.
And at that time, we had a lot of development going on, big development, and the developers would send all the different groups the plans initially anyway for them to review. So we'd all get them, Board of Health and Highway, everybody, Water, Sewer. And when I came to Charlton, it didn't work that way because we're much smaller. It was a much bigger town and more developed. So the way we're working it this way is what's being done with VGG is no different, I don't think, than is being done with anybody. I think the process is the same for everybody. It's no different. And maybe it should be improved, I don't know, maybe it should be changed, or maybe that's what will come out of all this. But I guess what I would like to ask you tonight is, what is it that you're asking this board to do right now?
Can I give one more piece of information before you answer? Through the chair.
Yes,
Go ahead.
it's DJ. Go ahead. If you can be brief.
Very brief. I just want to point out the timing. So the planning board got the developer, requested an extension from the planning board of 30 days. They have a definitive set of time they had to make the subdivision decision in. So that takes them to the 6th. According to state law, you guys only have 45 days from when you get the plan to send your decision to the planning board. That's what I have, the state law on my phone. I just emailed it to you and asked you to share it because I don't have everybody's emails, or I would have done that right now on my phone. I could do it from home later. But my point is, according to state law, you guys only have 45 days from when you receive the plan to let the planning board know if you approve it or deny it. And it says the planning board, not the planning board, the Board of Health, I'm sorry.
And is
So
that the final
I'm
plan?
just pointing out that it doesn't say final, it just says definitive plan of a subdivision.
I would assume that that's the final.
So
That would be a final plan that's been approved by the town engineer that would come forward with it if we had any further comments at that period. But this isn't a final plan. This isn't, and that's what I told Bill, and when I met with Todd, I said, where are you at this? Because this was given to Patsy, but this is far and away from. So if there was a final plan approved, say, by the town's engineer, which I don't think he's here, but if he decided that was, then we would have 45 days to look at it.
Okay.
Yeah, it's,
Thank you.
this is not a final plan.
I-
In the notes here, you can see that we made, there's several, there've been several requests by the planning board for reviews, and that was on the 19th. I think you said the 21st, there was another one, right?
Yes,
yes.
so if I may, Mr. Chairman, well, number one, the town engineer doesn't approve the plans, the planning board approves the plans.
Right,
exactly.
And the planning board specifically stated at their last meeting, and you can go to the videotape, that they requested the Board of Health to weigh in on their thoughts on this project. What,
And they-
okay, and.
I met with Bill
Okay,
Okay.
and Todd.
No, he wasn't at, Bill wasn't at that meeting.
well, it doesn't matter, I mean, they're, again, Bill and Todd are not the board. And the board specifically said that they want reports from the Board of Health on their take on this, as well as the Concom. And I believe that that's why we're here tonight, to express our concerns about this to you, to the board, so that you guys can, with good conscience, look at this and say, you're right, Mr. Kochling, there are safety concerns, and we'll relay that information to the planning board, or, Mr. Kochling, thanks for coming in, we disagree with your concerns, and you can write that note to the planning board. That way, at least when it goes to the next meeting on the 6th, the planning board has that information in hand, so that they can make their decision. That's, I think, how they're viewing this to go, and if you read bylaws or their laws, that's kind of how this is set up. They're saying, if there's a problem with a project that the Board of Health has or Concom has, they need to make that known to the planning board before they make their decision. And I guess that's why we're here tonight, is to say, look, pointing out all these safety concerns and problems, and we're asking the Board of Health to weigh in on that with correspondence to the planning board for the next meeting. Not after the planning board meets, but before. And I think, is that fair to say? Is that?
Yep.
It is correct, Mr. Chairman. And to answer your question, Mr. Walker, I think what we're here to do is to request that your board express your concerns, if you have them, with these plans. I think Ed is an engineer, and he has the knowledge that I don't have, but he does this for a living, and he has gone through these many plans, scoured them, and sees the deficiencies that are clearly apparent, that we hope you would consider with an open mind, and draft a letter to the planning board expressing your concerns about these plans as they currently exist.
Well, I'd like to my mind, I think you're right, if nothing else, for transparency and clarification. It would be to the planning board. If it was me making the decision, it would be a list of some of the concerns for clarification, and also feedback from not only the planning board, but also Mike and Andre. Because I know there are revisions that are obviously taking place on a regular basis, but we certainly don't want to miss the boat and just have it bypass us like it could some of the other boards, which to me seems like a real disservice to abutters and the town and the developer. Because if we were to catch something tonight and say, wait, that's out of regulation, and it does affect something, you don't want to be doing that after everything else is all said, and then it has a domino effect. So, Kathleen, Matt, you have not said one word.
I'm just listening, hearing what they have to say about it.
You have some more expertise on these projects than I do. Maybe not to this scope, but you've been on this board a lot longer than I have. That's why I'm kind of looking to you now for what you might do regarding their request.
Well, my comment is there's a process that this town has followed and has always followed, whether the project is this big or this big. And I see this project following in those same footsteps. I don't see it. I'm sitting here and looking at what's going on, and I'm still thinking, but it's stormwater and it's water. You know, if there's product in the water, like I'm feeling like what's in the water. If the water's contaminated, it's like that's the red flag the Board of Health is looking for. For stormwater, I just see like I think that's a conservation issue. Clearly there's a highway issue. Clearly there's a fire department issue. I'm not really seeing the Board of Health issue here. I respect what you're saying about the safety concerns. And maybe I'm old school from what I know from this board, and maybe Kathleen's right about maybe things need to change, but I'm tending to agree with Mr. Philbrook on how that process is going, and that's how I'm seeing it. But I wanna sit here and respectfully listen to all of the concerns, because that's, you know, I live in town too, so I wanna hear the concerns, but right now, I think it's in its process where it needs to be.
So if I may point out that I hear you loud and clear, very articulately put. However, if you look at the document that I submitted today, it clearly shows health concerns of the water. And so that triggers your concern about it being a health problem.
Yeah, that
Okay,
was.
all right, so it's very clear that this type of system has that component, and I think that's a reason for weighing in on this. Okay, per your your statement. I understand the stormwater thing, and it was, to be honest with you, it was a surprise to me when I'm reading the case law stuff, and it actually got into the health department part and said that the health department is, you know, they're responsible for safety and well-being in the town, and they are actually the authority on it. And so when there's something that's not safe, you know, they weigh in on it and should weigh in on it. And actually, to be honest with you, it holds more weight than the planning board.
So you're saying the concern is what's coming out of this discharge system?
I'm saying there's a concern, that's one of them, and the other is the safety concern of washing out the road and causing a road problem and a road hazard. And the third major one is the fact that the road doesn't meet the commercial standards and it will cause a traffic, you know, dangers. So there's three safety components there. One is more towards what you're talking about as far as, you know, bacteria, E. coli, all those issues. The other two are public safety. You know, the road not being the proper sizes for this type of commercial subdivision. And then, of course, there's the other component that we're not being told what's going in here. And that's, to me, you know, could be very concerning, because we don't know what it is. How do we know what questions to ask? And if it is something to do with, you know, manufacturing or dealing with, you know, compost or the agricultural component or waste component, then it's going to be a real big health problem. You know what I mean? Then you are going to be dealing with odors and other things.
Right.
So,
Mr. Chairman, one last note from me that we haven't discussed tonight with regard to health. This orchard, it's been tested, and there's arsenic in the soil. And the more water you drain out of that hill, the more arsenic is in the water, which then drains down into Dodge Pond, South Charlton
yes.
Reservoir?
Yes, that's good. It goes into Mr. Moore's fish pond, and then from there actually goes further down into Dodge Pond.
And I know that this was discussed previously, and I believe we touched on it maybe here or elsewhere, maybe it was at another meeting, getting confused as where these things all happen. Yes, Jim?
Mr. Chairman, I did speak to Bill, and as I mentioned before, and I told him I don't really have a definitive plan to look at, so if they don't come forward with something that would be a final document that Grays would give an appeal to, then the board would say no to a project like this, because we don't have the opportunity, like you said, to have the 45 days, which is normally for Title V. You have 45 days for review plan, site plan. But I have not been given the paperwork they have, nor is the board. That's why I met with Bill, and Bill said that they're currently, if they don't come up with a definitive plan, that they wouldn't pass the planning board anyway, because they didn't come through with the revisions that they've requested in the timely manner. So that's what I'm saying, if we could let the process follow through, but if I did get a final plan, but if you want me to forward the plans to you, if you even looked at these, and I brought them at our last meeting, there's not much on them. We don't even have what they have there. So for us to say that we're going to jump ahead before it's done, that's the only problem I have. And I don't have a vested interest. I don't live on that road, and I understand it's a major project that needs to, but I think, as Kathleen stated, we need to make sure that the town does its due diligence before a project's approved, and I don't think they've done that yet.
I just don't want to miss the boat on this, on the 45-day window. I don't want the planning board coming through, what'd you say, 3-6, 3-9?
Yeah, 3-6.
3-6. All right, I want to get that straight. Am I going to be in trouble if I go to the March 6th meeting as a board member by myself? Or as a...
No, you can't, there's no quorum if you go by yourself, but we can post a meeting in case,
No, I mean, I wouldn't be going, I won't be here, but, March 6th.
But
I just, the way that you're talking and the way that sometimes, I don't wanna say blindsided, but sometimes things slip past, I just don't want the 45-day window. What I'd like to see is something where the plan is 99% complete, maybe there's one or two small revisions, and then they say, okay, everybody, and plans go to Concom, Highway Department, Board of Health, who else am I missing? There's gotta be other, water, sewer.
Highway.
And, yeah, I think I mentioned highway. And then say, okay, you've all got receipt of this, great, we got 45 days, we're gonna get together, at the planning board with, engineers and Graves Engineering, and review and make sure that everybody's set and squared away and happy. Maybe not happy, but at least they're to the rules and regulations as they should be. And I'm kind of leaning towards what Jim said, because these revisions are just so rapid fire. I would hope that if you've brought this up to Graves Engineering with what seems like pretty legitimate complaints, that they are looking at this and taking, positive steps to either explain to you, yeah, here's what it is, I'm gonna ask them to do this, or there's no concern because our calculations are such, something along those lines.
Mr. Chairman.
Yes, Mr. Russell.
I believe that every time Valley Green Growth submits plans, they consider those plans 100% complete.
Right, until somebody comes back and says you need to.
So,
Re-engineered.
I mean, so the interesting part of this is that that's what's been going on. That's why there are so many revisions, because we've been able to come and point out, like, for example, they missed the catch basins here that dump across the street into the backyard. We've done our due diligence over and over again, and it has to come to some point where the plans are just not acceptable, they're not safe. And in this particular place, there is no way you can make this safe when you're dumping all this water from 9 acres out onto a country road that doesn't have a drainage capacity, one, to handle it, and number two, where it's being dumped on private property.
Yeah.
So, and I guess, it would be very much appreciated if, you can come to the meeting for yourself, but I'm a little lost with the planning board, their regs saying you guys have to weigh in, and then demanding that you weigh in at the last meeting, because that's why we had the last 6 weeks. And it says right here, you have to get a set of plans from the developer. Why you don't have the latest set of plans, I have no idea. Well, that's a violation of the rules. We're playing by the rules, and it doesn't seem like these guys are, so.
Totally
Mr. Chair, maybe you could go to the meeting and just explain what it's saying, that you don't have the plans.
I'll be there.
Yeah, we
Matter of
haven't
fact,
had a
I'll
chance
sit,
to
I'll
review
go
them.
on up and we'll sit side by side,
Okay.
and we'll go on over some of your concerns. And if it's okay with the board, I will just view my concerns, not necessarily concerns, but
Questions.
questions. We need clarification. I want to hear on videotape from Mr. Andrade, hey, we're working on this, and your specifics, I want them answered. I want the planning board to say, yes, Mr. Andrade guarantees that there won't be drainage problems, that there won't be arsenic going into somebody's fish pond, and Todd and everybody else, hopefully they'll be there. But I'm sure Mr. Andrade will be there, and I promise you I will be there.
Very good.
Right.
Jim,
Thank you
one
very
more
much.
thing for me. As far as the stormwater management thing, Todd has been appointed as the town stormwater management representative.
So, with that said, that sounds good, but Todd hasn't been to one meeting yet, as far as I can tell, maybe one.
see, I
So-
wish
so
I could-
that's-
I don't-
That's
Excuse
the
me,
part
Mr.
that makes you
Chairman, I
worried.
did talk to Todd just before this meeting.
Yeah.
And he said he was totally on top of this, and he's working with Graves, and he's been going through certain parts of it, Graves does another part of it. And, he would have stood there and talked to me for another 15 minutes, explaining to me what he had found if I hadn't had to come to this meeting. So Todd is, from my perspective, from my talking with him, very involved with this.
Well, I hope you're right.
So
we've
he
got
may
two
not
different-
be
well,
being
two different
responsive to you
opinions.
guys.
Well, it's not a
but-
question of responsibility, I just haven't noticed them at any of the meetings, so maybe it's me, but, that's fine. It's not, this isn't about Todd or what hasn't been done, it's what needs to get done.
Yeah.
You know, and so I'm very grateful, thank you for your time, and I think that it's fantastic if you can come to the
I
meeting.
will be there.
Because, you know, it'd be great for the planning board chair to say to you, yes, we
Yep.
did, you know, we did request the health board to weigh in on this.
Right.
And obviously you guys didn't get that memo, so there's a disconnect there.
Yeah, the-
We do have somebody from Valley Green Grove. Did you want to speak, sir?
Yes, Mr. Chairman, if I
Can you
may.
identify yourself, please, for the
Yeah,
record?
come on up and have a seat and just identify yourself, just for the record, for our meeting minutes.
Sure, my name is Dan Leary. I'm a project manager with Valley Green Grove.
Okay?
And thank you for having me here.
Well, thanks for coming. It's been you've been sitting here for a couple hours now.
It's all right. So first, we're just to clarify, because I heard a number of comments about the cannabis cultivation project, and to be clear, that project's been disapproved. It's in a it's pending an appeal right now, and this project right now is just the definitive subdivision plan. So we're not. It hasn't been proposed to have trucks and things like that. It's a definitive subdivision plan for the purpose of freezing the zoning for this parcel.
And getting, if I can interrupt, just getting that first 9 or 10 acres or whatever developed, is that it?
It's on paper for the purpose of freezing zoning.
Okay.
So no facility has been proposed for this.
While you await the outcome of the land court and whatever.
Or if the owners decide to continue with the project, possibly, but this definitive subdivision plan is just for the purpose of freezing the zoning on the property right now. But I guess more importantly is we do disagree with a lot of the discussion that's happened tonight, because I do feel that if as you speak with Mr. Gerard, with Mr. Andrade and others, you'll see that the iterations that have come about have been very reasonable. About 6 weeks ago, we submitted the plans that have been relatively unchanged for the last 6 weeks. Last week, we got, and we submitted copies of that for Board of Health and Conservation. I believe that they've made it to where they needed to go for review. But last week, we did sit with staff in town, including Mr. Andrade, to go through Mr. Coughlin's comments and make sure that anything that was in there that we hadn't addressed in a previous revision was addressed. So the revision that was submitted last week to the town addressed a number of those comments that either Mr. Andrade or Mr. Gerard felt we didn't adequately address. So that's gone back. We did receive some comments back from Mr. Andrade on that. In fact, the most current version of the plans were submitted today. They included a couple of changes. There was an acronym, BFP, that it wasn't clear what it meant backflow prevention. So we added that. So the changes were relatively unsubstantial, is my opinion on it. But I would just encourage you to speak to Mr. Andrade, Mr. Gerard, and Mr. Scanlon to understand the process that we've gone through. But I believe that everything that was discussed tonight has been addressed, and we feel that Mr. Andrade and the town's review will show that.
Okay. Well, I'm looking forward to the meeting. I don't know if you folks will be there at March 6th, will you? Okay.
And we'll be happy to answer any questions
Yep.
that come up.
Good. Good.
Can I
Yes.
ask a clarifying
Yes.
question as a observer trying to understand the decision-making? Mr. Leary,
Mrs. Smith?
when you
We're friends and neighbors now.
Oh, that's what I was.
When you mentioned that you've addressed all of the concerns to date, could you speak specifically to Mr. Gerard Russell's concerns about water flow onto his property and the size of the pipes? Was that addressed in the most recent iteration of the plan?
can I ask, if,
Yeah.
could we,
Yeah, go ahead, speak freely.
Mr. Novak?
Whoever feels best qualified.
For the record, Mike Novak from Meridian Associates, project engineer. May I ask a clarification question?
Yes, go ahead.
Can you, I just wanna make sure I'm following you. We're talking about what pipes? The pipes on site or under the road?
The off-flow of water from the property being proposed to be developed,
Mm-hmm.
and the impact that that would have on the neighboring properties.
The impact that would have on the neighboring properties. In
It's
regards-
not a trick question.
No, I
It's-
wanna understand your question, that's all.
Yeah, it's not a trick question.
Right.
It's specifically, what are the off-flow of water, sometimes called stormwater,
Mhm.
some kind, whatever it's called, the water that will come off of the property and flow into this private ductway into a private residence property. Has that concern been addressed in any change in the plans that you've made?
I think I'm with you now, thank you. In regards to that particular question, the stormwater management, as Mr. Coxon went through very in detail, has not in any form or major fashion changed. And the drainage report, which I think Mr. Philbrook showed, or is there, gives a summary of the storms or storm events that we've modeled as required by your bylaw, and shows that there is a slight reduction in both peak and volume of stormwater runoff through the mitigation measures shown before leaving the property. So I think, and the last probably 2 sets of revisions, there has been no major change, or really even minor change, other than some nomenclature clarifications to that entire system.
So the plan that was presented and just shared and discussed by
Is
the,
actually
is,
two revisions old.
but minor, nothing that
Right, no.
changes in substantial, in substance,
Correct. I
the
think if you laid them-
offlow of water.
If you laid them together, you would not see any major.
Any difference.
Any major changes in terms of the overall system.
Okay, so just trying to clarify it for, home viewers.
My opinion, of course, but.
Right, so that this is basically the plan and the concerns that were just presented have been presented to the Board of Health for consideration, and that the current version of the plan was accurately reflected in those concerns by the neighbors. I don't live in that neighborhood, so it's not like I have a dog in this fight, so to speak, but I, as a citizen of this country and an active voter and someone very concerned about individual taxpayer rights of residents who live in this town, who have for years maintained their properties. You have to take your shoes off to go to the Russell's house. They take very good care of their home. They're concerned about how they're gonna live going forward with a neighbor and someone dumping water onto their property. I would share those same concerns at my home or anyone else's home. You would not want to have a pipe suddenly leading to your home to flood your property. So I would ask that the consideration of the individual taxpayer in this town be taken seriously and be given due consideration by our elected representatives on the Board of Health, and the concerns that were expressed, please be considered.
If I could just make a
Yes.
point of clarification. There is not a proposed pipe that directly outlets water onto Mr. Russell's property. I just wanna be clear with that. There is not a proposed pipe across the right-of-way that we are proposing to go onto Mr. Russell's property. I think we're talking about the culvert that exists now.
Yes.
Okay.
Correct.
I just wanna be clear that, is that,
The color.
yes, okay.
Yes.
I just wanna,
The culvert that exists that will take the water from your project
right,
will,
will not see an increase in water based on what I said.
I think that's the point for
That's the
dispute,
point.
that
Right,
I
and
heard
that's-
presented,
Well,
correct.
that's,
Right.
I'm writing some notes down, and we're gonna get this again on video,
And that's fine. I
March 6th in the evening with Mr. Andre there. He's the true expert.
Mr. Chairman,
Well,
could I make?
I'm sorry, we just learned Mr. Andre may not be
He
there
will
on
not
the
be there.
6th.
Yes.
He will not
So
be there?
That's
it might
correct.
be a discussion you'd wanna have with him.
We are trying to work with the planning department to figure out the best solution to that,
All right,
but we just found that out
All right.
yesterday or the day before.
I'll still go
last
in
week.
front of the planning board.
Yeah.
I want the concerns.
But that's new information to us
Yep.
as well.
Yep.
But I think if you'll go through the previous comment letters from Mr. Andre, you'll find that in regards to drainage and hydrology, we are in agreement that we are meeting the standards required by the town, him and I.
Okay. It'd be nice to have him there, but it's not the be-all and end-all if he doesn't. Jim, can I take this copy with me when I go? I'll
Sure,
bring
you
it
can
in.
take that plan and that copy with you.
Oh. Homework. Okay.
Mr. Chairman, can I
yes.
ask one more question?
Yes.
I'm just getting used to the rules here. So,
all right. So am I.
If it took me a minute. So, if the plan is a paper plan and it's just to freeze the zoning, it doesn't actually show any proposed structures or even the actual realistic amount of impervious surface that you might end up building. How do you expect any board, Board of Health, Planning Board, Conservation Commission, to know if you have designed adequate stormwater and sanitary facilities? If you are presenting a plan that does not show enough detail, how do you expect them to make a rational decision?
Can I answer that? To my mind, this is news to me that this was just to freeze a small portion of the plan for the zoning.
So it's to freeze the whole 100 acres.
Well, to freeze the whole 100 acres, right, so I can see where you're coming from, but all we've got to go on right now, I mean, I don't see anything, or I haven't seen anything on a plan that says, oh, after the zoning is frozen, then we're gonna put in this 30-foot high structure on, you know, in these rows back on this 40 acres situated here. This isn't even part of that.
Yes, sir.
Right.
There's no site, there's no proposed site plan. That would be a
Right.
future site plan.
So in this case, this is segmented, so all we can look at is whatever the engineered plans are for this, what was it, 9 or 10 acres or whatever was mentioned earlier. And unfortunately, you have a valid point. We as a board and Mike Andrade and engineers and BGG, I think, are just saying, okay, let's take this one step at a time. Because you don't want to throw all this money at all this and then find out, oh, guess what? It's, you know, the courts have deemed that you can't do such and such on that property. Yes, sir.
As a point of clarification, may I add that a definitive subdivision approves the proposed roadway and the lots, and they meet frontage and area.
Right.
That's it.
Mhm.
So if anyone wanted to put any kind of structure, they would still need a building permit, which would still allow a cursory review from any department that has jurisdiction. This plan does not allow anyone to put any type of structure. It
Right.
only approves the roadway and the lots for frontage and area. That's my understanding of definitive subdivision law.
Yep. Okay.
Building
Yes.
one large
This
duck
is
pond.
Russell from Old
Yep.
Grove. However, the site plan has already been presented. A site plan has presented. We cannot pretend that we don't know what's gonna go up there. It has been denied, but to pretend that it doesn't exist doesn't make any logical sense. Technically, maybe that's how you have to look at it, but it's like, you know, we've had a premonition. We've seen what the site is proposed to be.
So what would happen was if the appeal went through and then the court said they're allowed to do their original site plan, your concern would be then that they would just, once they're given the go-ahead, they could just go ahead and do it without any further review or anything. Is that what you're saying?
No, I would hope not. That would all have to
Okay,
go
all
back
right,
to the
okay,
planning board and all
all
that,
right.
yeah. But to pretend that if the first thing we ever got from BGG and 44 Old Worcester Road was this cul-de-sac and we're gonna change the lots, then we could pretend we don't know what's going on. But we know what's going on because the site plan was already presented.
Right.
So
what you're saying is the rest of the facility will also have other concerns and could feed into this, and I understand where you're coming from.
Mr. Chairman, and this will be the last word from me.
Are you sure? I'm writing this down.
The proponents are saying that the purpose of the subdivision plan is to freeze the zoning. We get that. But if the planning board were to approve the definitive subdivision plan, they could build it. Now, they're saying they won't, but they could build what is on that plan right in front of you.
Right.
Take this big chunk out of the Orchard Hill and put up this big cul-de-sac of asphalt and this huge football field size underground water detention system. They could build that. They could build that because they have a plan. It's been denied, it's in court, but they've got a plan. So they could just build that. And, you know, call me crazy, but I've had the biggest mouth here. And I don't think it's I don't think it's just chance that that's right across the street from my house, dumping water onto my property. I don't think it's just by chance. That's it, I'm done, thank you.
Good.
Go ahead. You were shaking your head first, so I'm gonna give you a chance.
I
can give the technical reasons as to
there's technical, I'm sorry, I wouldn't want anybody to have that feeling.
Yeah.
There's a technical reason why it was placed there. That actually wasn't even the original site of the proposed subdivision, when we first presented to the planning board. Following initial, I should let Mike Novak answer
No,
that.
you're doing great. Go ahead.
Yeah, following the initial discussions, we did adjust it to a site that had better line of sight and for safety of traffic reasons. So I adamantly would not want any, or the Russells to feel that there's a reason why this is proposed right there. That's absolutely not the case.
So you moved it from the first location, I do remember where that was, to this location because you're for better line of sight and traffic. What would the traffic be going to and
Yeah.
driving away from?
Yeah.
Is it a
That's
building?
fine.
Is there a skating rink? What do we?
I'll answer this in two parts. The preliminary subdivision, which is, I think, what my brother was referring to as he remembers the first location, the required site distances could not be met. Required site distances are in your bylaws, and they're also dictated by AASHTO, the American Highway Safety. In order to meet those, we had to move the cul-de-sac to its current location to maximize those site distances. Those site distances are determined by AASHTO through multiple charts, speed limits on the road that you're entering, the speed limit of the road you're coming from. There's actually multiple steps to determine those. It actually has not a lot to do with the true traffic generated. It's about the roadway geometry. So I hope that answers the question.
Mhm.
And feel free to, I mean, I'm not an expert, but that's how it's determined and that's how we proposed it, and Mike Andre has reviewed. So
Well,
I'll leave it at that.
I think over just for after 8 months of listening to all these meetings and going to these things, and you developed a certain bit of skepticism, and you guys, it would probably do you service to come clean and tell us what you're going to do with this property. It'd probably take a whole lot of weight off. It might, because by saying nothing, you're doing yourself a disservice, and you're just raising that whole skepticism townwide by not telling us what you're planning on doing with that. We know you're going to shave off 30 feet of the top of the hill. We know you're going to you're planning on putting up a 1 million square foot building. Is this going to be we know it's a non-residential site, that's all we know, which that even raises the skepticism level when you say it's a non-residential. We know it's not going to be 2 houses like it was on the first set of plans.
Speaking strictly as a permitting mechanism, right now, even though we're here to talk about the subdivision only because that's the only application that's in front of the planning board at this time. But if I can speak to that really quickly, there's no permitting mechanism to create that 1 million square feet right now because the site plan was denied. So if VGG went in to apply for a building permit, it would be denied because it's required, site plan review approval is required, which was denied. So I understand the question, but the town has already determined that answer.
if and when the court comes back and says the town was wrong. I think that's what these
And
folks.
Mr. Leary spoke to that earlier, if the owner decides to pursue anything at that point,
Right,
we'll be right back here.
okay. So the site plan would start all over, you would say,
I
okay.
honestly don't know. I'm not an attorney,
I'm
I
trying to
don't speak to,
remember.
I won't.
Okay,
if
and I don't know.
Yeah, I prefer not to speak to
Yeah.
speculation on what could happen after that, because I just don't know.
Mrs. Castillo.
The only reason they went for site plan review is because of the host agreement. The host agreement specified it. If they were to get approval on that, that freezes the zoning, and they can go get another host agreement that doesn't say anything about site plan review. You see what I'm saying? The only reason they went
even
for
if the
site plan
court
review
agrees with
is
the
because of the host agreement.
It just sounds like a project that large would need a site plan review,
It
regardless of
wasn't
whether it's
required.
piggybacked off a
That's why they
smaller
wanted to
project
freeze
or
the
not.
zoning. It wasn't
Well,
required.
another question for the planning board.
Yep,
I think you may be correct.
I know, right?
Yeah.
Yeah, it's pretty ominous.
Yeah.
Yeah. So something that size, that's the size of Wyman Gordon and Grafton, that's the size of, you know, what else is a million square feet around here that
Yankee
manufactures
Stadium.
stuff? Yeah, Yankee Stadium, I mean, you're talking huge, to not have site plan review, that's what they can do, they can come back with the frozen zoning, submit another plan, and they don't need site plan review. So I'm saying that people, I'm running the boards that have authority per law, I mean, our bylaws and the state law give you three a vote on this thing, and the reason we all ran in here to come to our elected officials to say like, hey, you have a vote, and we'd really like you to say that there's not enough detail here to approve this thing. It doesn't say that there's any way that you could handle the sanitary needs of any commercial use. They don't even have sewer up there because they got a $16,000 abatement. They don't have town water up there because town water doesn't exist down there yet. How do you expect, with no public water source, how in God's name could they fulfill the needs of any commercial need with no town water and no town sewer? And possibly a humongous runoff of dirt and water into the roadway. It just seems like a foolish thing, you know? That's why we all ran in here.
I figured as much.
We're like, elected officials, help us!
Anybody else? March 6th. Board members, Matt, Kathleen?
Well, I won't be here on March 6th, but,
Matt, are you intending to go then?
I can, I'm
You know, I'm not asking you to go, I'm just saying if the two of us went, I think we would have to post maybe.
Yeah, you can attend the meeting as a
As a-
resident, but you couldn't go and talk on behalf as a Board of Health member.
Couldn't vote.
But I can.
you can by yourself, yeah.
By yourself, yes.
I can by myself. All right.
But you can't have a quorum.
Nope. That's what I want to clarify.
So
that.
we could say, we could make a motion that we met with a number of people tonight, and this has brought up many questions that we're very concerned about, and we need to have them answered before we can make any approvals of any plans. Would that be all right with you, Matt?
And along those lines, that's one of the reasons why I volunteered to go to the March 6th planning board meeting, to get the questions and concerns clarified from the residents who were at tonight's meeting. Jim?
If I'm being honest, my meetings with Bill and stuff, I felt that this was a ruse for a stall, in my opinion, and I felt that way, and I asked him, how can you have this, there's no building, there's nothing, there's no infrastructure, what is going on with this? And that's why I wasn't happy. I met with Bill and said, what is their intent here? And I've even had some emails, but to me, I think, just my opinion, and it's I always go by it's not who it is, it's what it is, what they can plan on. And to me, I think what I see here today is what she just said, is something to keep the project moving forward in lieu of legal. And because to see a project like this, I review hundreds of them, and I'm looking at it saying, what is this? Because that's my job. You hire me as the health director, saying, I'm not sure what this is. So I met with Bill. He's like, it is what it is. So, and I met with Todd and Lang today. So that's just my opinion, personal opinion. But we have to go follow the process. That's all.
Okay.
So how would you know when the 45 days is up?
Well, that's one of my questions.
But
Bill
we
would
need-
notify
we need
me
to know
that there's a
when
final
the
plan,
45 days starts.
and we
When
have
the
45
days
days from this
starts.
point forward.
Right.
Right, yes.
Um,
Yes.
excuse me, from my research, the board should have received the initial plan. They should have received the preliminary subdivision plan from VGG. It should have come to you stamped through the town clerk. And, that's when this should have all started. We don't know if how many plans you have received, if this is the first plan you've received. But the bylaws say that the developer is supposed to submit its plans, the preliminary plan, and then come back and submit the definitive plan, which in this case would have been 8 plans ago, which doesn't look a lot like this one.
Mr. Chairman, just to weigh in on it, as sitting on this board, I'm not taking sides, I'm just, my experience, this is not the first time something like this has come through the board. There's been other projects that has freed zoning, and the applicant has the right to go through their process to do that, and that's where they're at. So it's not speculation, whether it's correct, incorrect, the future says it, but based on what their rights are, they're following the process. And this is not the first time this board has seen a freeze in zoning. It's happened, so.
Yes.
So I agreed, and I think you, Mr. Leary, declared that when you first sat down, was that is the purpose of this subdivision plan, is to freeze the zoning. However, if that subdivision plan is approved, and if it were built as described in the plan, there's a concern for what the runoff would be to the neighbors. And then there's a second level of concern about what the process would be after approval of such a plan, if it, in fact, if there was a way to mitigate the water situation onto private property, what would be the implication of the board approving this plan, and at what level of review would the next plan be required to come to the board, is a significant concern. The Yankee Stadium proposal for marijuana cultivation includes a large power plant, which has its own set of concerns on an agricultural property, and a proposal to grow facility and a tie-in to a major propane or liquid gas pipeline, and the health effects of whatever air quality impact that size facility would have on the neighbors who are in direct line for those air runoffs, the equivalent of water pollution, but the air pollution that would come off from that. I think at what point would these kinds of plans be coming back to the Board of Health for review is really important to understand before any approval is given.
Couldn't have said it better myself. Are you gonna be at the March 6th meeting?
I hope so.
Because I was doing a little
God
research.
willing.
We do hope so.
I was doing a little research, and I was trying to figure out what the setback would be for a power plant from residential areas. And I spent a little time on Google, and was not able to come up with anything. But curiously enough, it came up with all of the power plants in Massachusetts. And I said, well, this is going to be a gas power plant. And then it showed the Millennium Power Plant, which, by the way, has gone through 2 bankruptcies. But it would be about 20 times larger than what's proposed here on the original plan, which we're really not talking about tonight, but since you mentioned, I'm going to. 16 megawatts for what would potentially go in, as you stated. So take it from there. I mean, would I want to be downwind from that?
No.
A couple hundred yards or a quarter mile or whatever? Probably not. So I would